All right, are we recording? We're good to go? Thank you, Nelly. So, good evening, everyone. Welcome, especially if you're here for the first time. I know we at least have one participant here who's in the attendees section who's here for the first time. Thank you for being here tonight. My name is Maria Ortiz. I am the co-chair of Housing, Health, and Human Services. My co-chair is Joe Restuccia. He will be on this meeting very shortly. Oh, there he is. I just introduced myself. So I'm Maria Ortiz, and there is Joe, my co-chair. This is the March monthly meeting for our committee. The agenda and the materials for tonight's meeting are public. You can view them on the Manhattan Community Board 4 website, or if you're on the listserv, you would have received an email of the agenda and a link to documents probably for the meeting. Per the governor's order, we have been meeting remotely, and this meeting is being recorded and is currently live streaming on YouTube and will be accessible after the meeting. If this is your first time, the run of show is basically that after each presentation, first, the committee is going to ask questions and make comments. Then the members of the public or attendees have the opportunity to do the same. Subsequently, the discussion goes back to the committee. On some agenda items, members next vote to write a letter of support or write a letter to make recommendations. Most important is how to get your voice heard, and that's going to be if you need to speak to make comments or ask questions after each presentation and after the committee speaks, you must press the raised hand button, which should be on the bottom of the screen. If you're calling in, and I saw there were about 2 callers, if you're calling in and you want to speak, in order to raise your hand, you have to press *9. And then to unmute, *6. Again, that's *9 to raise your hand and *6 to unmute. Are there any questions so far? If there are, please raise your hand right now. Let's see, I don't.
There are 3 questions from the public. Jennifer Malakote, Brian Matlin, and then a phone number ending in 076.
Lily, can we bring the first?
Yes. Jennifer, you can unmute.
Hi, I unmuted. Can you hear me?
Yes.
I couldn't find the agenda or the materials. I went on the website and I also received the email, and I'm not finding the agenda.
Nellie, can you help?
Yes, the agenda's on our calendar page.
Yeah, I'm on the calendar page and I went to the Dropbox and.
Why don't we just announce what tonight's agenda is, since there's only 2 items on the agenda? That way the whole public.
Dolores, there's also items in the Dropbox that maybe she wants to view.
All I'm saying is we can send that to her later. We should probably just announce what that agenda is.
Well, all I see is 316, which is the social, like yesterday's meeting. Nothing's there from today for today's meeting.
So, Nellie, can you put some sort of address or something in the chat, and then Ms. Malakote can get it.
The chat is disabled.
Okay, give me 1 second. Hold on 1 second.
Thank you, Nellie.
The chat is also disabled. I'll wait for you guys.
Yeah, we'll figure it out, and we'll come back to this in a second, okay? So let's go to the next person. Brian, if you can bring over Brian Matlin for a question. This is a general procedural question as opposed to substance, right?
Can you hear me now?
Yes.
Hello? Okay. It's actually related to the last question. I'm just looking for the materials. I had the agenda, but not the materials. It would be helpful, especially for the second item on the agenda, if there are any presentation materials, to be able to view them directly as opposed to just hearing them described.
Of course. We'll get that.
I don't know if there's a link you can share in the chat. I don't see it in the Dropbox or anything like that.
We'll have Nellie work on it and then figure out a way to post this so everyone can see it.
Great, thank you.
So it'll be shared during this meeting. And then the final person?
phone ending in 076. You have to unmute. What is it? *6?
*6 to unmute.
Yeah. You have to press *6, otherwise we can't hear you. Perfect, you got it. Go ahead and speak. Identify yourself, please.
Hello, am I here?
Yes, we can hear
Yes.
you.
Hi, oh my God, I'm sorry, it's been so hard logging into your meeting, but first of all, I assume this is because of the property, 258,
I'm sorry.
278
Can I
8th
just?
Avenue?
I'm sorry. Can I just stop you for 1 second? I was asking
Yes.
if anyone has questions about the process of the meeting, and if you could please identify yourself. What is your first name?
Hi, okay, my name is Larry Risco, R-I-S-K-O.
Hi, Larry.
Hi, how you
So
doing?
right now, I was just asking if anyone has questions about the process of the meeting. We would like to get the meeting started.
In
No,
regard,
I'm
Go ahead.
sorry, I'm here and I'm ready for the meeting to evolve, yeah.
Oh, okay. You want to ask questions about the second item? Okay.
so just so
Yes.
procedure, we will have a presentation first about another item entirely, and then we're getting to this 278 8th Avenue second.
Mhm.
And after,
Okay,
yeah, so, but just wanted to make sure that you didn't have any questions about how everything works. In the meantime, for everybody, we're working on getting, Nellie, how will we post the link?
I have to go back into the settings so that I can figure out why the chat is disabled.
Right, because the chat should be the same. Right, okay. We'll get that to you guys. Just give us a moment. The first item is, Maria, take it away. Oh, Maria, in the meantime, announce the agenda with the additional items on it that we're talking about and reporting on.
So the first item is NYU Langone. Second item is 278 8th Avenue. I think I got it right. And then we have, for new business items, excuse me, we have 3 things to update on. NYCHA vaccination session at Hartley House and vaccinations occurring at the temporary shelter location.
So just say it again because Maria was coughing. We have an update on Chelsea NYCHA. We have an update on vaccination session at Hartley House and an update on vaccinations for temporary homeless shelters. Okay, if Maria's okay, I can turn it over to you to start the first item.
All right, so I am okay. Dr. Zhang, thank you for being here. He's a primary care physician at the Manhattan VA and assistant professor at NYU Grossman School of Medicine. His teaching focuses on advocacy for vulnerable groups and how to translate scientific evidence into the practice of medicine. Dr. Zhang will be presenting an overview on how COVID vaccines are tested, their efficacy and side effects, and the vaccine hesitancy, especially in communities of color. Dr. Zhang is going to present for about 7 minutes, more or less, giving us space to ask questions. But before you begin your presentation, Dr. Zhang, can you just share where you are working on vaccine development with and whom the partnership is with and what that includes?
Sure. Actually, just real quick, are you going to run the PowerPoint or am I?
Nellie will be running the PowerPoint.
Okay, sure. Then I'll just say next slide when it's time.
Yes. Yes. Thank you for asking.
Yeah. So my clinical practice is at the Manhattan VA Medical Center, but the NYU Vaccine Center now has sites at 5 different locations: the NYU main campus, Bellevue Hospital, the Manhattan VA, and then NYU Brooklyn and NYU Long Island. So I'm based out of the VA, but I do spend time up and down the block on First Avenue. Does that answer your question?
Yes.
Okay, great. So should I take it away?
Yes, take it away. Thank you so much.
Okay, so I've been asked to come here and present a little bit about what work the NYU Vaccine Center is doing as far as the development of vaccines against COVID-19. You can advance the slide. Anyone familiar with this building? So this is the smallpox hospital on Roosevelt Island. It was opened in 1856. Now, here's an interesting fact about the smallpox hospital. There was already an effective vaccine against smallpox in 1856, and many New Yorkers had already received it. In fact, the earliest documented vaccination against smallpox dates all the way back to 1499, believe it or not. The earlier ones involved either exposing oneself to the scabs of somebody who already had smallpox, or better, to inoculate yourself using a different disease called cowpox that primarily affected cows and had very little in terms of harm to humans, but your immune system would then build an immune response against smallpox, and this saved many lives. The mortality rate of smallpox is somewhere between 20 and 30%. It was a very deadly disease. So the 100 years or so later, in the 1950s to the 1970s, there was the worldwide vaccination campaign against smallpox. The disease was eradicated. It is the first and still only human disease to be eradicated through vaccines. And this signaled the beginning of the modern era of vaccines. In total, smallpox killed probably around 52 million people and caused untold human misery. Because of a successful vaccine program, this hospital, which was once filled with sick and dying people, now stands as an abandoned and quaint reminder of a bygone era. Advance the slide, please. All right, so again, who are we? Our center here at NYU, the mission is simple: protect and improve human health through vaccine research. As I said, we have 5 sites at the NYU main campus, Bellevue, Manhattan VA, and then NYU Brooklyn and NYU Long Island, formerly known as Winthrop. Our current studies on COVID vaccinations include the phase 3 Pfizer, I'll explain what these mean in a moment, the Oxford AstraZeneca phase 3, and the Sanofi phase 2. Advance the slide. Just some quick history. I won't go through the history of COVID itself because we all lived through it. But as far as the NYU site is concerned, the phase 1 trial of Pfizer actually began in May. 3 months later, they launched the very large phase 2 and 3 trial. At the same time, in the summer of 2020, is when the vaccine center expanded to include the 4 other sites around New York City and Long Island. In September, we launched the phase 3 trial of the Oxford AstraZeneca vaccine. And I'm sure you all recall, in December, Pfizer was the first COVID vaccine to get an emergency use authorization from the FDA. Just last month, the Sanofi phase 2 trial began. Advance the slide. So let's get into just a little bit of how are vaccines actually tested. The long and the short of it is this slide. Phase 1 and 2 are designed primarily to assess safety. Phase 1 is usually just a few dozen young, healthy volunteers, and the goal is entirely to make sure that the product is safe. Phase 2 then expands it to a few hundred, usually still young and healthy individuals, still mostly focused on safety, but then now with an eye toward side effects, dosing, and setting up for the prime time trial, which is phase 3, which involves thousands of participants. In the case of these COVID vaccinations, tens of thousands. So the aim in a phase 3 trial is to recruit a broad group of people who are representative of the target audience. So you can imagine for a heart drug, you need to find people with a certain kind of heart condition who will benefit from that drug. In the case of COVID-19, I guess every human on the planet pretty much could be in a trial, but the most important thing was to recruit people who are vulnerable to severe COVID-19. So older, sicker people and people from communities of color. A strong phase 3 result leads to FDA approval. Phase 4 is kind of a loose term. Basically, it means that a drug or a vaccine or a product is already on the market, and it continues to be closely monitored for safety and effectiveness. So an example that everyone is watching in real time right now is the Oxford AstraZeneca vaccine. It's not approved yet in the US, but it is all over Europe. As I'm sure you may have read in the news, there was recently a pause on that vaccine being administered because some groups had raised concerns about blood clots being associated with it. The health ministries of the countries in question went and investigated, and actually, as of today, they've announced that they are recommending that the campaign to inoculate people with the Oxford AstraZeneca vaccine in Europe can resume. So that's how clinical trials work in a nutshell. Let's keep going. Next slide, please. Just for instructive purposes, what I'd like to do, obviously we could talk about any number of trials, but just so you can all understand what actually happens in a clinical trial. I'll just walk you through what happened in the Pfizer phase 3 trial, of which our site was a member. Right. So you've all heard the Pfizer vaccine is 95% effective, but what does that actually mean? And how did we arrive at that number? Well, let's actually just look at the data that Pfizer published. Next slide, please. So they sent out the call, right? Some of you may have even seen ads or were invited to participate. In total, 43,000 participants aged 16 and over enrolled in the trial. They were located in multiple countries, though primarily in the US and the UK. 83% of them are white, 9% Black, 4% Asian. So as I said, it's important for a clinical trial to try to represent the target audience, right? So the target audience is all Americans. And so if you look at these numbers, America is probably more like 13% Black and 5.5% Asian. So those two minority groups were slightly underrepresented, but not severely so in this trial. 28% were Hispanic, 21% were over the age of 65. Again, very important to make sure that you include plenty of the people who are most vulnerable to the condition. 20% of them had underlying health conditions. The most common of those were diabetes, obesity, a full third of them, and lung disease, about 8% of them. Next slide. So then what happens next? You've enrolled all of these people who are eager to help in this vaccine research. And then the next part is you randomize them, right? This is the famous double-blind randomization of a clinical trial. And so 19,000 of them received the Pfizer vaccine, 19,000 of them received the placebo. And the participants themselves don't at this time know which one they received. You follow them for a few months and you start to see who gets COVID and who doesn't. And so at the time when they first published this data, they had diagnosed 170 cases of COVID. And then that's when you do the unblinding. You now take a look and see who got what in that group of 170, right? And so once they looked, they saw that of those 170 cases of COVID, 162 of them had received the placebo and only 8 of them had received the vaccine. Now, very simple arithmetic. 162 divided by 170 is 95%. So that is actually where that number that you see in the press comes from. Very important also is that there were 10 severe cases of COVID. These are ones that required hospital attention. 9 of those 10 were people who had received placebo. So this is the data on which the FDA made their decision to grant the Pfizer vaccination the emergency use authorization. Okay, let's advance the slide. This one real quick is just a different way of looking at the exact same data. The red line on the bottom is just the count of cases in people who had received placebo over time. This is the first 120 days. The count in the blue is people who received placebo. It is very, very clear that people who would receive the placebo were much more quickly getting COVID. The little inset there, the little tiny graph at the top left is just a blown up version of the first the first 21 days. You can see that the two graphs start to diverge right around the 14-day mark. And that is actually where the FDA gets that number. If you've received the vaccination, you've probably seen that the FDA tells you you continue to consider yourself unvaccinated until 14 days after your second dose. This is actually where that came from. So none of this is made up. This is just stuff that we saw in the data, and then we try then to adapt it into our clinical practice. Okay, next slide. Next is side effects, right? This is probably the #1 question that I get in my clinical practice. Do not try to squint at this thing. All I'm trying to make a point of here is that, by the way, you can go and look at this yourself if you really want to see. But basically, this is just a piece of all the side effect data that was published as part of this trial. Let's just advance the slide and I will summarize what they put here. Basically, 1/3 to 1/2 of participants reported fatigue, headache, chills, and muscle aches. When you looked at the second dose, those numbers were slightly higher than the first, maybe by about 10% on average. Overall, the side effects were mild and there were no major safety problems observed. Next slide. So the next slide is just where we are overall, right? So we currently have 3 vaccines that have been granted EUA, emergency use authorization. You've heard their names, the Moderna, the Pfizer, and the Johnson & Johnson. There are 2 that hopefully will be dropping soon. Novavax recently published some very, very promising results. AstraZeneca is a strange beast because it is already approved. Even my number in the slide there is wrong now. 170, soon to be 140 countries will be using the AstraZeneca vaccine, but it is lagging behind in the US for a couple of reasons that I think I won't get into right this moment. And then Sanofi is a little further behind, but these 6 are probably the furthest along in the US. Obviously, around the world, there are many other vaccines that have been authorized in different places. Next slide, please. So how was this done so fast? You've all heard that traditionally this process takes 2 to 5 years, in some cases more than 10 years. These are the reasons in short. Number one is simply intense effort by all sectors. Healthcare, manufacturing, science, and especially government support was very helpful in this case. There were many things that they did to help speed things along without cutting corners, including using existing clinical trial networks and vaccine platforms. The NYU Vaccine Center already existed before all of this. So by using things we already had, we were able to move quickly. There was huge interest from the public in participating in these trials, right? Under normal circumstances, it's not easy to recruit 43,000 people to sign up for an experimental treatment. In this case, it was not difficult. Many, many people wanted to sign up right away. Manufacturing started while the trials were still underway. This is big. Typically, the company will wait until they've gone through the entire approval process before they start production of a medication or a vaccination. That wasn't the case here. You've probably heard of Operation Warp Speed. One of its main goals was to give companies pre-order money so that they would start making these things and working out their production before they even had any kind of FDA authorization. Now we're getting into some finer points, but the mRNA vaccines are theoretically faster to produce than traditional vaccines. Just the technicals of making them is potentially simpler. And then, of course, watchdogs like the FDA and the CDC prioritized this over all else in terms of their review of the data. The same data that I just showed you is what the FDA looked at. Next slide, please. Okay, so let's shift gears a little bit now and get into vaccine hesitancy, right? I actually really like this particular visual because it shows the fact that people are generally not binary on whether or not they want to get a vaccine. In fact, most people who are vaccine hesitant fall somewhere in the middle of this spectrum, right? At the very far right are people who demand the vaccine. I'm sure everybody knows a family member or friend who is so eager to get the vaccine that perhaps they did some things that I might consider shady in order to try to get one. Then on the other side, you may have a family or a friend who absolutely won't get the vaccine. But many people are kind of in the middle. They want to wait and see, or they ask people around them who they know and trust, what do you think? Or they ask people who have already gotten the vaccine, what do you think? My own mother is actually included in this. She's called me a few times to solicit my opinion on this. Next slide. So what we're showing here now is actually the US Census Bureau conducted a survey of a number of Americans to just see where people are. And so the number at the very left there is the number of people who say they would definitely want to get a COVID vaccine when available. That number is 50.9%, which I find a bit alarming. And so it tells us we have a lot of work to do. Next slide. This is now broken down by age and by race. Where we see here, so white people say that at about a 55% rate that they definitely would get the vaccine. That number is as low as 30% among Black Americans. And interestingly, it's higher among Asian Americans. That is 66% in this survey. Take it with a grain of salt. This is just survey data. So this is something you've probably seen in the news quite a bit, is vaccine hesitancy tends to be higher among people of color. Next slide, please. Here it is now, what people say when they say they are vaccine hesitant in this particular survey. At the top there, at around 50%, are people essentially saying that they're concerned about whether or not it is safe. Then toward the middle is people who raise issues of trust, essentially. Don't trust COVID vaccines, don't trust vaccines in general, or don't trust the government. Next slide. So I think there's something to try to address here, right? And now we're getting into, this is my opinion, which is that many Americans distrust public institutions, including the government and the healthcare system. And many people have good reason for that. People of color in particular can point to both historic and current examples of injustice in healthcare, and in the government and the police, education, all kinds of American institutions, right? People who have less privilege in this country can point to many examples of how they may have been mistreated, and their community may have been mistreated by these institutions. Many of you have probably heard of the Tuskegee syphilis experiment. This was probably the worst thing that ever happened in medical research in America. Without getting into the gory details, it was a very unethical trial that was run by the United States government on Black men between 1930 and the 1970s. And the legacy of Tuskegee continues to live on to this day to really challenge many Black communities' trust of the American government and the American healthcare system. And I can understand why, right? What do you do about something like that when our country has such an infamous history of performing unethical medical research? We've learned a lot of lessons, right? Many actually very important pieces of legislation have been passed, not only to ban the kinds of practices that allowed an experiment like Tuskegee to take place in the first place in the 1930s. But as a healthcare and research community, we've really taken the lessons of Tuskegee to heart. But does any of this really help to reassure a skeptical public? I would argue no, right? You know, Bill Clinton officially apologized on the behalf of the American government in the 90s for the Tuskegee experiment. But you can say you're sorry all you want. It doesn't help that much, right? There's only really one way forward, which is to learn from the past and promote justice now. It's exceedingly important for us to do everything we can to create a more just healthcare system, research system, so that we can move forward. And I would argue that's the only way to move forward. So that's a little bit of a depressing note, because everybody wants to know right now, you know, what can we do to convince people who are very skeptical to accept vaccination, right? And I'm coming at you with this idea that we have to think really big. But I think that's the truth of the matter. Anyway, but let's shift gears again then and actually talk about things that we can do now. Next slide, please. So the CDC is, they have a campaign that they call Vaccinate with Confidence. And it basically has 3 tenets: build trust, empower healthcare personnel, and engage communities. So building trust is to try our very hardest to share clear, complete, and accurate messages on COVID vaccination, and especially to fight myths and to fight disinformation. Empowering healthcare personnel. Now, why do they want to do that? When you look at surveys of people, especially people who are skeptical or hesitant to vaccines, and you let them rate sort of what might convince them to change their mind, usually right at the top there is if their doctor or their nurse or a very trusted healthcare professional tells them that they highly recommend it and that they've actually gotten the same intervention themselves. And so by trying to amplify the voices of healthcare personnel in this matter, I think it tends to cut through some of the noise that may be politically tinted, unfortunately, nowadays. And lastly, engage communities, right? Engage in two-way communication is very important. It should not feel like this is something that's coming top down. It should feel to everybody involved in this that your own community is mobilizing to help vaccinate individuals and to improve health within your own community. So we need to do that. We need to increase collaboration between healthcare health authorities and community members, and of course, to promote equitable access to resources. Okay, last slide, please. So I really like this quote. This is from Walter Orenstein, the former director of the U.S. National Immunization Program. He says, vaccines don't save lives, vaccinations save lives. So thank you, and I'll take any questions right now.
Thank you, Dr. Zhang. That was super informative and easily digestible, so I appreciate that. I have one question for you before committee starts asking questions. You noted that your mom called you a few times to get some advice. I'm curious, what were you sharing with your mother, very briefly? Ultimately,
I told her I highly recommend it, and I've gotten the Pfizer vaccine myself. The fact that I am a medical doctor, when you're talking to your own mother, doesn't necessarily overrule her position as my mother. But I think I've convinced her to come around. It's been interesting talking to my mother about this, actually, because she brings up the fact that she grew up in 1960s China, where no one had any choice in this matter. You got vaccinated against polio, you got vaccinated against smallpox, and that was the end of the matter. But the interesting thing about it was that everybody saw it as their patriotic duty and as a duty to their community. Actually, nobody asked this is according to my mother, all right? Nobody asked what's in this for me. Everybody simply understood that I'm not doing this necessarily just for my own protection. I'm doing this for my community and for my country. So it's kind of an interesting difference of perspective, I guess, because I think over here, understandably, we're more individualistic and we really want to know what is in it for ourselves.
Okay, makes total sense. I hear you. Thank you. I see Betty, then Katie, Josephine, and James. Betty?
Hi. Thank you for the presentation. Do you hear me?
Yes, we hear you.
I read recently that the testing did not use as many women as men, and also that women have had stronger side effects from the vaccine, me being one of them. And I was curious as to whether that was your experience with research on the vaccine, that there were many more men than women, and was it as intensely researched for women? Thank you.
Sure, yeah. So I know that some of the trials, especially the earlier trials, tended to recruit maybe slightly more sort of different groups. At least for the Pfizer phase 3, it was 49% women. It was just about 50-50. Some of the trials actually, in fact, had overrepresentation of women. Some of the trials, if I recall, in the early stages were as much as like 70% or more women. The reason for that actually is because many of those early trials recruited from healthcare providers. And actually, when you just take the healthcare community at large, physicians are about equal, but actually, when you take all healthcare professionals, it skews very strongly toward women because nurses are predominantly women. I don't know off the top of my head exactly what the data looks like when you break it down by sex in terms of side effects. It would not surprise me if there are some small differences. What's important to know is that by and large, everyone did well. And there was actually quite a bit of individual variation. I can share my own story. I have never in my entire life gotten very ill from a vaccine before. In fact, I poo-pooed it quite a lot. The Pfizer vaccine absolutely knocked me on my back. I really could not do anything the next day. And so, that's taught me some humility as far as vaccine side effects are concerned.
Okay, thank you.
Thank you. Katie, and then Josephine.
Thanks. That was such a great presentation. I love the data. So thank you. I had a question. So you showed us the information that the Census Bureau did in their survey, about vaccine hesitancy. And I wondered, because in some organizations I'm involved with, it seems like there's been a real shift in like the last 6 weeks or so, when more people have been getting vaccinated, that there seems to be less reticence. And I was wondering what the date was of that survey. And then if that's your experience as well, if you feel like things are shifting, and if that survey was done now, do you think there would be sort of an appreciable difference?
Yeah. First off, yes, that survey comes from just a little after the new year. So it is somewhat old data at this point. When we're talking about COVID-19, I guess something that's 2.5 months old is ancient by the standards of how fast information moves with COVID. So I would expect potentially now that there could be some movement, certainly as visible members of some communities do get vaccinated and tell their stories. I think that will help. But I don't know off the top of my head of any update on that, at least as far as actually published data. Your last question was, in my own experience, am I seeing that? I think so. I mean, I take care of a panel of around 600 veterans at the VA in my primary care practice. And I've been surprised a little bit at, some of my patients who have really, I don't want to say I didn't expect them to go for it, but I would have expected more resistance potentially. The veteran population is very specific. We have a lot of Vietnam veterans, for example, who really have suffered quite a lot at the hands of the United States government, for example, right? And so for them, there's even more of a burden for them to trust something that's being pushed so hard by the government and authorities in general. But anyway, to answer your question in short, I would think so, but I can't prove it just yet.
And Jose, thank you.
Hi, thank you so much for being here and all of the important information. So I have two questions. The first is NYU part of this trust building coalition for communities of color? And I'm happy that you brought up the Tuskegee Institute, the tragedy that happened, but quite honestly, when I went into the hospital to have my child, my main concern was maternal mortality rate and was I going to make it out of the hospital. So these are issues that continue and are very relevant today. So that's my first question is how are we actually building trust among communities of color that hospitals are actually going to take care of us? And then the second question I have for the trial in general, what did the environments for everyone who participated, how did that affect whether they got COVID or not? So I guess really my question is, were the people in similar environments, or did some people have, were some people essential workers and other people working at home? How did that affect who got COVID, as opposed to people who had placebo or not, regardless of that?
So these are two very good questions. Your first question, I would say, is the billion-dollar question, right? How can we try to build more trust among vulnerable communities when we're coming from the healthcare system, right? And I'm going to be honest with you when I say that I don't know the answer to that, other than to say that I think we need to think even bigger than healthcare by itself. Right. Healthcare is a huge American institution. And I think only by promoting justice across all American institutions can we really actually start to undo the very ugly legacy of racial inequality in America. As far as the more specific question you asked on that front of just, how would NYU in particular try to engage these? That one I also don't know off the top of my head, actually. But I know that they are trying to. We are trying to develop relationships with a number of different community groups. I can speak a little bit more of just our site at the VA because that's where I spend nearly all of my time. But we've been trying really hard to go to meetings of different veteran groups, especially veteran groups who primarily are comprised of veterans of color, to show our faces, talk to them, listen to them, engage in two-way communication, listen to their concerns, and try our best to address them. But the truth is that this is an extraordinarily difficult problem that most of us are trained as scientists and as doctors, and at least so far we don't necessarily even have all the training and the tools necessarily to think big enough, I think, to tackle this problem head on. But I'm very glad that this conversation is happening. I'm very glad that these questions are being raised. I think it's really important for people to keep asking these questions and to keep thinking about what we can do about them. I'm forgetting what your second question was. I'm sorry.
Oh,
Can you
yes,
repeat it?
that was about the participants in the trial.
Right.
What did, okay.
Yeah, so subgroups analysis is always a major part of clinical trials, especially a large trial like this, where you recruit so many different people from so many parts of the world that eventually you really can start to break it down by subgroups. The initial publication of the data from Pfizer, it had only pretty limited subgroups analysis. They didn't do a geographic one, I can tell you that. Although I would expect that as they have more time, as their data scientists have more time to parse this stuff, I think we will start to see quite a bit more of that come out. So at least in the published data, I have not seen anything broken down by location. They did make an effort to break them down by some of the things that you would probably want to see just at first brush. Like, was the vaccine just as effective in people who are older, for example, people over 65? The answer was yes. It was maybe very slightly less effective just by the numbers. I think it was more like the high 80s in terms of percentage rather than the 95 when you take all comers. When you took, I think it was when you took Black Americans, you actually got a number that was more like 97 rather than 95%. I might be flipping those two. But if you look in these trials, you can usually see these things called forest graphs, where they try to sort of separate it out by all these different groups just to see if there are any interesting differences in terms of the effect of the vaccine among different groups. And what was really good to see here is that it really did appear to be pretty universal across all of the groups. I'll give you an example of a time when it hasn't been. So I mentioned that the Sanofi trial currently is in phase 2 only at NYU. Part of the reason the Sanofi trial has lagged so far behind is they actually had a different vaccine that was more or less on the same schedule late last year. But then when they did the subgroups analysis of that older vaccine, the first one they had tried to develop, they found that when they looked at older Americans, it seemed to be far less effective than in younger people. And so they actually abandoned that vaccine. And so the current Sanofi vaccine that's in trials now at our site is actually a new version of it that they've specifically developed to try to make sure that it does in fact help seniors. A lot of this stuff actually happens behind the scenes. And so when you're a member of the public and you're just looking at this from the outside, it's actually, I'm really glad once again that people are actually asking these questions because I think it will really help if people understand that actually people are thinking about these questions, but maybe they're just not good at communicating them to the public.
Thank you, Dr. Zhang. I see James and Hector have their hands up, then Leslie, and then we'll go to the public. Oh, Paul, you wanted to ask a question also? Dr. Zhang, I'm just going to ask if you can keep your responses a little bit briefer,
Okay.
because we also have to go to the public.
Okay, sure.
So James, Hector, Leslie, then Paul. Guys, if a question has already been answered, let's let someone else ask the question.
Thank you, Maria, and thank you, Dr. Zhang. I feel like if I got to take a class from you, I'd really enjoy it, but I may not pass because I didn't get through organic chemistry. So the first two questions should be really brief. Side effects for people who've been previously affected or infected. Is there any correlation? I've read some reports. Any word on that? And then I want to quickly go to the next question.
So there's this, I would almost regard it as an urban legend at this point that people who had previously been infected experienced a higher rate of side effects. We haven't seen that in the data. Again, people say it, it could be true as we learn more, maybe, but so far we haven't actually seen that in the data.
Great. Next question, again, as brief as possible. Any idea of what percentage of a given populace would have to be vaccinated to allow for a significant reduction in the likelihood of transmission? And I know that's related to R0, and with the mutations you have, perhaps higher transmissibility. But if you could just comment on that briefly, because I have a couple more questions.
Yeah. Oh boy, that's another that's $1 billion question there. Different experts have given different opinions that range anywhere. Most of them range somewhere between 70 and 90%. Again, the term that James has used, R0, is how contagious the virus is, right? So the less contagious a virus is, the lower percentage of the population you need to vaccinate before you really start to see numbers fall. And so the 70 to 90% estimations you've seen come primarily from the original strain of the virus, right? The Wuhan strain, if you will. Now that we're looking at more contagious variants, I don't yet know if there are widely accepted updated predictions on what percentage of people would need to be vaccinated to achieve, that magical herd immunity. Yeah.
So next question. Is it true that continued prevalence of infection increases the likelihood of mutation? And I feel like
that was the third one.
I'm sorry. In any case, is it true that the continued prevalence of infection increases the likelihood of mutation?
Yes.
It just seems logical that if there's, the more people are infected, the more replication errors there might be as the virus is creating copies of itself.
Yes, absolutely. The longer the virus is multiplying inside of your body or jumping between different individuals, it's essentially every time the virus copies itself, there is a chance of it developing a new mutation. And then once in a blue moon, that new mutation will turn out to be one that's very beneficial to the virus, which then means it's bad for us, right?
I would just, if you don't mind, I would just like to encourage you and the rest of the medical community to repeat that statement, because I don't think it's being said enough. We're very focused on trying to get vaccination just for general public health, but the fact is it's a ticking time bomb, and the longer we wait, the more people resist, the worse it's going to get. Last question, very briefly. Long haul COVID is just now, I know this will be the last one, but I was very brief, and Dr. Zhang was brief. Long haul COVID is just now starting to be understood. I know a number of people who've been affected. Are there ongoing studies about how the vaccines may or may not affect that? Thank you. That's my last question.
So the short answer to that is yes, long haul COVID is definitely being studied. We have people even from the original spring surge who we're still following, actually at NYU, not as a vaccine trial, but actually as what we call a natural history trial. We keep up with those people to see what happens to them. As far as the interaction between vaccines and long haul, that one I don't know yet of any formal study being launched, but I would certainly expect it to be talked about.
You could be the first. Thanks, Dr. Zhang.
Hector?
Dr. Zhang, thank you very much for taking time out. First of all, thank you for your work at the VA. I'm a veteran myself, and I actually go to the Harborside Medical Center myself. And I just got vaccinated 2 weeks ago. I wanted to congratulate you guys on the way you organized it. And I'm wondering if, because basically the process I went through was, I called my primary care, told them I was interested. And next thing I know, I got a text from the VA saying, hey, we got the vaccine available for you. When do you want to do it? And here are the dates available. And it was so streamlined and organized, which is, I hate to say it, it's quite different than the VA norm, because usually it's hurry up and wait kind of attitude there. But they really got on the ball with this one. They were on our A game. And I was able to get my appointment within a couple of days after that, and then get the second dose 2 weeks after that. Very organized, very streamlined. Is there any discussion about possibly utilizing a system like that for the general public? I mean, I know it's a larger scale, but I mean, there's obviously a breakdown with so many providers and so many different locations being utilized. And the biggest obstacle we're running into here is that folks don't have access to computers to schedule the appointments. And I'm thinking that the way the VA handled it was so streamlined and easy that it should be used generally for pretty much anybody else who needs it.
Yeah, so what Hector is referring to is that the VA has actually used a texting chatbot to reach out to veterans. It basically texts them and says, hey, you're eligible, write me back with when you're available. And the machine is actually smart enough to understand what you texted back and actually make an appointment for you. I agree. I was pleasantly surprised. The VA is not famous for being agile or good with new technology, but this one worked quite well. I don't know what else to say. I wish that non-VA healthcare agencies could have a system like this. I imagine they might have some challenges that we don't. The VA knows who all of its patients are, how to reach them, and actually what their health history is, which, the state of New York, the city of New York, they don't have that advantage. And the other advantage the VA has is its massive scale, right? They can try to push through a major intervention and put a lot of resources behind it. So I would love to see, that kind of thing roll out to many other communities. Unfortunately, I don't know if, your local governments would be able to, but yeah, I agree with you. I was actually very pleasantly surprised by the way it's worked. And, it's interesting to see that the VA vaccination program seems to be maybe about 4 or 5 weeks ahead of the rest of New York City. They're currently vaccinating veterans of all ages. Actually, they don't have any age restriction because they've been able to get it out pretty smoothly. Hopefully we can learn from this and use it as a model in the future for, as other things come online, as other vaccines are rolled out, maybe the civilian healthcare agencies can learn more from some of the things the VA has tried in this case.
Leslie?
Thank you, Doctor, for the presentation. It was fantastic. 2 questions. One, following up on James's question about herd immunity. Does that 70 to 90% include people who are vaccinated as well as people who've had the virus?
That's a tough question. The best evidence we have suggests that people who have had COVID before probably do have pretty good natural immunity. The latest estimate we have is for at least 6 months, although not all, right? There are documented cases of people getting COVID a second time, sometimes even after not too much time. And so that, we try to be very cautious and conservative with the guidance we give for people getting vaccinated. So the current guidance of the CDC is actually, if you've had COVID more than 90 days ago, just to go ahead and get vaccinated if you're eligible, because, I think everything favors just being cautious with this one. But in theory, to answer your question in short, in theory, people who recently had COVID are mostly not susceptible to COVID again. And so you theoretically could count those people, right? There are examples of even entire countries that have attempted to take this approach where if you just get enough people sick with COVID, then you develop herd immunity. It hasn't gone so well yet. So, some combination of the two, and predominantly using vaccines rather than the actual infection is the best way forward.
And your second question, Leslie?
And one last question is, what's your thought about COVID passports going forward?
Gosh, this one's a tough one because on the one hand, the concern with COVID passports, right, is if you have a situation where there is unequal access to the vaccine, which currently is the situation, then, what this can do is this can entrench inequality, right? If only some people can get the vaccine and then those people get additional privileges, and perhaps those privileges may include certain employment opportunities or certain things that could help them, then this can perpetuate inequality. So that is my concern with COVID passports. But I can completely see the other side, right? In order to live a normal life again, we probably need to try to create spaces where people can feel safe and can do things like dine indoors. Boy, that's a tough question. It seems like policymakers are moving in the direction of actually allowing for COVID passports, but just watching carefully to make sure that it's not creating a system that perpetuates inequality. But I would definitely share your nervousness watching this one evolve.
Thank you. And I see that Jennifer on the attendee side has a question. Nellie, can you bring her over?
And just want to know for everybody that we have spent now 1 hour on the matter. So we're going to be moving to another item, and that will have about 30 to 35 minutes. So we really have to condense and conclude our first discussion.
Paul, can you?
Yes.
Yeah,
Yes.
if it hasn't already been answered.
Oh, I don't believe it has been quite.
Okay.
It addresses a detailed thing. Thanks for the great info, Doctor. In terms of the MNRA vaccines, I've been told, and I think you said just recently, that they're faster to produce than traditional vaccines, or the other kind of vaccines, or however many there are. If that's true, to James's point earlier, this idea that we are in a race between the rate of vaccination and how fast the variants can replicate and reproduce and invent themselves. That seems to be, first of all, that is the situation we're looking at, correct?
Yes, in a way, yes, yeah.
All right. And the other question is just sort of historical. I think the numbers that I recall, something like 50 million deaths worldwide from the 1918 epidemic and 675,000 American deaths. Looking back with the knowledge that we have now, since viruses were virtually unknown, do we imagine that a similar sort of race, well, there wasn't a vaccine, but do we imagine that the longer it took to get to herd immunity or enough people having had the virus, that there was a similar race between herd immunity and variants from that pandemic, or is that just all guesswork at this point?
I mean, the short version is, we don't know the answer to that. It's starting to feel a little bit that way, unfortunately. But I'm an optimist. So the worst case scenario, right, is that we start to get many variants that have substantially lower rates of protection from the vaccines, right? So say the South African variant turns out to really go worldwide, for example, and really surprises us with just how much it can resist the effects of the vaccine. That's the worst case scenario. Then we develop new vaccines against the South African variant and some other variant pops up. That's the worst case scenario. I don't know that we're there yet. In fact, I don't know that we need to worry that much about it just yet. Unfortunately, this one is a bit of a, just do your very best with what you have right now and kind of watchful waiting on what happens with the new variants that may actually affect vaccine efficacy. Currently, the predominant new variant that's spreading around here is the B117 from the UK, which, while more contagious, seems to be just as susceptible to the vaccines we already have. So hopefully that will continue to be the case. But yeah, it's a thoughtful question. I wish I had the answer.
So possibly, if you want to really get hopeful, the fact that that the MNRAs can be put together faster than traditional vaccines might mean that they can also be retooled, or might not.
In theory, I'm not an expert on the basic science of that, but I mean, the way that mRNA is actually manufactured can be done at massive scale. It's actually the bigger challenge is the stuff that you surround the mRNA with, the lipid nanoparticles, which in theory shouldn't have to change if you have to change the contents of the mRNA itself. So in theory, the mRNA vaccines could be more agile if you needed to suddenly retarget them at something else. But hopefully that theory will translate actually into real product.
Hope so. Thanks very much.
So I would ask that Nellie bring over, there's two members of the public, Jennifer Malacote and Brian Matlin, and just be aware that our time is limited. Jennifer, go ahead.
You guys hear me?
Yes.
Yes.
Okay, so I have two questions. One is personal and one is not. Thank you, Dr. Zhang. I mean, you gave a lot of information. I have autoimmune disease, psoriasis specifically, and I take Tremfya, which is a Johnson & Johnson product, to lower my immunity. So I've been nervous about taking the vaccine because, Johnson & Johnson couldn't tell me if it would have a negative effect on me. And my doctor couldn't either. So that's my first question, if there's any research being done to that. My second question is part of the conversation that you just had about people that have had COVID and then get the vaccine. I have a group of friends, one of my friends that owns a wine store and a cheese shop in the East Village, and 9 of 12 employees got COVID. And in her building, which is 4 apartments, 3 of the apartments, which are all couples, they all got COVID. They all ended up getting the vaccine and got sicker, more sick, sicker's not the right word. They got more sick from getting the vaccine than when they had COVID. That's not really, that's an open-ended question or comment. So I don't know if you could just address those two things. I'm just trying to educate myself more.
Sure. So these are both very good concerns, right? People with certain autoimmune conditions were not recruited in many of the initial phase 3 trials. The reason for that, the justification for that was primarily to first try to test it on people where we could expect them to overall represent the physiology, if you will, of the coronavirus. But now this is leaving us in kind of a tricky spot, right? Pregnant women were not in the trials. Younger children were not in the trials. And so what you see in many cases is you get this very unsatisfying answer, both from our public health agencies and from your own doctor potentially, which is simply that, we didn't test you in this trial, therefore I don't know whether or not you should take this vaccine. I would say that approach is probably overly reductive, overly cautious as well, because, we don't just make decisions entirely based on the raw data, right? At the end of the day, medicine is an art as well as a science. And by understanding the human body, human physiology and disease physiology, in many cases, we need to help you actually make a decision based on incomplete information. And when we have incomplete information, what we generally do is we try to say, do the potential benefits outweigh the potential risks? I would say in the case, I don't know your particular health case, but in the case of most people who suffer from autoimmune conditions at this point, my general opinion, and again, I would talk them through it, but my general opinion is that the benefits of getting vaccination against COVID vastly outweigh the potential risks in most comers for people with autoimmune diseases, even in people who are pregnant, in children who are high risk, right? But these trials are now beginning. Now they are trying to study these so that we don't have to just make this sort of risk and benefit weighing, that we can start to have more data to back up the guidance that we give people who have these conditions.
Thank you, Dr. Zhang. Brian?
Yes, thank you. This is sort of connected to the response you gave to Paul on the issue of variants that are less responsive, if you will, to the vaccines, which I understand you're saying you don't think at the moment is of serious concern, but obviously the issue in general is of concern. So my question to you is, what mechanisms are currently in place in the medical community to be tracking that issue, to be looking at variants that are coming in and becoming more present in the population that may be less responsive to current vaccines, and then what mechanisms would be utilized to communicate that and give people guidance on what they should or shouldn't do? Because obviously people's behavior is changing as they get vaccinated, and maybe they're going to change in ways that become less appropriate if more virulent strains come into the population.
Sure.
Thank you. I'm sorry, Dr. Zhang, before you answer, if you could just make it brief. And Nelly, can you move Brian back to the other side and start bringing over the other presenters?
Boy, it's real hard to be brief when you guys ask these really good, thoughtful
really
questions.
Good questions. Our community is awesome.
Yeah, gosh, the short version is simply that, for one thing, we simply don't have enough information yet at this point. In the United States, we have not done much genome sequencing where we could even identify variants. So in America, we're trying to very quickly bring that to scale. That might be more of a question even for policy people than for people who are in vaccine research. And then the other one is there are vaccines under development right now, actually. The companies do try to sort of play three-dimensional chess, many moves ahead. And so to my knowledge, Pfizer, Novavax, and I believe Johnson & Johnson are all already developing vaccines that target the South African variant. Hopefully they will never have to come to market. The other thing is that the existing vaccines we have, perhaps with the exception of AstraZeneca, although actually we'll see with AstraZeneca, they do have some amount of efficacy against them. And so to the earlier point, if we can simply get our global numbers down low enough, then actually it becomes a non-issue almost, if we can simply across the board get enough people vaccinated so that there's very little community transmission. Hopefully that helps.
Thank you, Dr. Zhang, for answering all our questions. I appreciate you being here. I think we have all our next agenda folks here, but before they speak, which Joe is going to introduce, just want to give a plug for next week. We're having our Social and Racial Justice Task Force is having a health disparities forum to talk about maternal mortality, COVID-19, and vaccinations. So that's next Tuesday at 6:30. Go ahead, Joe. Thank you.
Thank you very much. And I think this first part of the meeting is really important because everybody is just talking about this every day, and having Dr. Zhang here really helped us a great deal, just get some basic information. Even though we know we're going to need more and we have all kinds of people with all kinds of issues, really want to say it was good. And to the public, thank you very much for listening through this. The next thing is 278 8th Avenue. This is a privately financed affordable senior housing project. Acronym, PFASH, okay? I want to note that we have never seen one of these before, and there's a possibility we may never see one of them again because of how the city has changed its rules and regs. But to set the stage for it, in 2016, the community board reviewed two major citywide zoning changes: MIH, mandatory inclusionary housing, and ZQA, zoning for quality and affordability. And these were citywide text amendments. We debated them extensively. And in fact, our board's position on those two zoning actions when we got to city council was incorporated in the final text amendments. So we're very familiar with these. We haven't seen this though, but specifically what it is, this was under the ZQA portion, the Affordable Independent Residences for Seniors. And what it allowed was certain changes in how buildings are built, and Al Shine will correct me in a moment, and density if an owner included affordable apartments for senior citizen households. And very specifically, it is not about only seniors. There has to be a senior citizen in the household, which is very useful for us in our neighborhood. That means there can be a grandmother, there can be two seniors living together, somebody younger. So it's not just solely one single senior individual. In front of us tonight is this proposal. Now I want to note, although it sort of feels like inclusionary housing, it isn't inclusionary housing for the following reasons. The city has not written any rules or regulations about it. We're going to have a very open conversation about what's being proposed, and we will have an ability to ask questions and also to come to agreement on things. The site is on the northeast corner of 23rd and 8th, where the current Walgreens is located, and there's been a two-story commercial building there for decades. We're seeing tonight the proposal for a residential development there, and as part of that residential development, there will be affordable apartments included for households in which a senior citizen lives. 44 apartments. I don't want to speak more about that. First, I'm going to ask the development team to introduce themselves one by one, the developer, the attorneys, the architects, and just note what your roles are. Al Shine has been to our committee many times presenting inclusionary housing projects, and Dan Kaplan as an architect, has been to our community many, many times at projects. So introduce yourselves first, give us a background, and then go into the project. Al, you're on mute.
Okay, I'm here. Thank you, Joe. Thanks for the introduction. Let me say a few minutes of background. I've been very involved in trying to get the AIRS program off the ground for the last few years. I was immediately trying to get the HPD commissioner to adopt a term sheet when ZQA was adopted. For whatever reason, I don't want to criticize HPD too much because I've already been taken to task for criticizing HPD. So I'm not going to make it personal, but it just did not happen. Nothing happened until last year. And finally last year, there was a term sheet for AIRS, which HPD renamed PFASH. PFASH means privately financed affordable senior housing. AIRS means affordable independent residences for seniors. So the city's very good with acronyms, and sometimes it's hard to understand what the acronym is about. But the background is that there's a huge need for independent senior housing in the city. It goes back to the baby boom generation, of which I am one. Post World War II, veterans came home, started having kids, and they were the baby boomers. The baby boomers are now in their 60s and 70s. And a lot of them are looking at retirement. A lot of them may be making a good living working. When they go into retirement, the pension or the Social Security is nowhere near what they were earning on salary. There are different situations. Many have lost a spouse or can't afford the rent anymore. There's just a huge crying need for affordable senior housing, which has not been recognized in the city. So here we have a program called PFASH, the essence of which is it's privately financed as compared to the other city senior program called SARA, which is a heavily subsidized senior program, which is for a building, its model is a building only for seniors. You can't live there if you're not a senior. It's a different type of product. What we have here is a mixed income, privately financed building, no city subsidies at all, totally privately financed. And about 25% of the units will be set aside for families or individuals, and at least one person of the household is 62 years of age or older. So it's not assisted living, it's not a senior building, it's a regular apartment house, but apartments will be set aside for seniors at really affordable rents. The developer here, who I will introduce in a bit, has gone to great lengths to make this as fair and as an appealing, affordable project as I've ever seen. And I've seen quite a lot of it. Oh, let's start with this. Under the statute, the rent for heirs units can be set at 80% of AMI. We're not doing that. The rents will be from 40% AMI, 60% AMI, and a few at 80% AMI. But the majority are at 40% AMI and 60% AMI. So it's a lot more affordable than required under the statute. Under the heirs provision, there's no distribution requirement. If they wanted to, they could dump most of the apartments, most of the senior apartments on the first couple of floors. They're not doing that. The heirs apartments will be distributed on floors 2 to 9, right? The first floor being commercial. The heirs apartments are not going to look any different than the market rate apartments. They're exactly the same size by unit type. The finishes are going to be the same. They're distributed on all 4 sides of the buildings. They're hitting every mark. Every mark I've ever asked about in this community board is being met. Quite honestly, I'd be surprised if anybody has anything critical to say about this. Now, here's the thing.
There's always somebody critical, Al, just remember.
Yes. Here's the thing. By surprise, a couple of months ago, HPD decided it's ending the PFASH program. So suddenly there was a mad scramble to get plans together so we could get into HPD. This is the only project, not just in Community Board 4, that's going to be PFASH. It's the only one that I'm aware of that's happening in Manhattan. CB4 is going to get the only PFASH project before they shut down the program, which I'm very sorry about, but I'm happy for CB4. You're going to get 44 senior units, beautiful units, and none of the issues of stigma that sometimes attaches to affordable units. Nobody's going to know who's living in a senior unit or not. There will be one distinction, which is required by HPD, which is that every PFASH unit must be handicapped accessible, meaning shower bars, wheelchair radiuses. So the idea is that if somebody is living in the unit, ages in place, they may be perfectly mobile now, but in coming years, they may become disabled and they don't have to move because the apartment will be already ready for them if they become disabled. So I think this is all good, and I'm really thrilled to be involved with this program, this building, I should say. Just in case somebody's not familiar what the rents are at the AMI scales, at 40% AMI, the rent for a studio will be about $732, and for a 1-bedroom, the rent will be $781, and for a 2-bedroom, $931, which is very affordable. And by the way, in the SARA buildings or the subsidized buildings, you're not going to see any 2-bedroom apartments. Those are all studios and ones. Here, there will be 2-bedroom apartments, which will be available to families with a senior, could be adult seniors with teenage children, happens all the time in Manhattan, or an adult living with a child, with an adult child. there are a lot of flexibilities here, and I think it's going to be really fantastic.
Al, let me just clarify on AMIs. You said 40% to 50% or 60?
40, 60, and 80.
So in this building.
You have 10% of the units will be at 40%. 10% of the it's 10% of the units in the building will be at 40%. 10% of the units in the building will be at 60, and a few of them will be at 80%.
So just for people's information, what that means for 40% income-wise, people qualifying between 31,480 up to 40,960, at 50% from 39,800 to 51,200, and 80% up to 63,680 to 81,920. So that's a pretty broad range, and our community always asks for that broad range of incomes to be able to qualify. So we are really helping not just one group or another, but spreading out the benefit as much as possible.
Right, and that was the idea. We wanted to make it broad ranging, not just to one income tier, but a lot of different income tiers that people fall into. We didn't just set it at 80%, which may have been too high for a large portion of the community. So at this stage, I want to introduce the development team. The ownership, ownership is 23 8th Avenue Associates, LLC. It's a development arm of JJ Operating. JJ Operating is owned by the Jamal family, and they've owned the property for over 30 years. They're long-term owners. They are not planning to flip the property. They are building it, and they are committed to the neighborhood in terms of building a quality building and something that will be a credit to the neighborhood. Alchemy Properties is the development consultant for this project. On our virtual dais here, we have Ken Horn and Lucia Finn of Alchemy, and they will be available for questioning or questions, and may make some comments as to what we're doing. If I slip up, they'll step there. FX Collaborative is the architect, and Dan Kaplan is here, who's going to do the presentation of the project. And at this point, I'm going to turn it over to Dan.
Great. Thanks, Alvin. Should I share screen, or can you pull up the presentation? How do you want to work it?
Nellie will do it, and then you can tell it in advance.
Great. Thank you. And good evening, everybody. And it's very nice to be in front of Community Board 4 again.
We might note that it's 2021, though, to begin with, right?
Yes.
Thank God.
Yes. It feels like 2020. So next slide, please. So we're just going to go real quick because I know everybody's been sitting around for a while. So talk about the site. What is the building going to look like from the outside? Number 3, a very quick area summary. We're going to walk through the floor plans. We're going to show you the typical PFASH units, and we're going to talk about the unit interiors. Next slide, please. So the site is, as Al mentioned, is a full block frontage on 8th Avenue between 23rd and 24th Street on the east side of 8th Avenue. Great light and air on the site. Wide street on 23rd Street, wide street on 8th Avenue. 24th Street's a narrow street, 60 feet wide, but the Penn houses on to the northwest have a big, large open space. It's well served by public transit as well, with the 8th Avenue, 7th Avenue, and even the 6th Avenue line, and of course the buses, which the stops here are in purple. Next. Here's a picture of the 8th Avenue frontage. Full block frontage. Next slide. 23rd Street looking west. It's really the limestone building where Boston Market is, going to the corner. Next. And then 24th Street. Again, limestone building on this side, sort of unfortunate in terms of the way it hits the ground, very unfriendly. Next slide. So the first sketch rendering is on 8th Avenue looking north. 23rd Street is in the foreground. We're talking about a 14-story building with primarily a cornice line at 10 stories, and then the building sets back 10 feet on 23rd Street, 10 feet on 8th Avenue, and 15 feet on 24th Street. But in order to mark the very important corner of 23rd and 8th, we've created a corner tower of 13 stories. The building will be primarily masonry, brick. We are looking at brick colors now. It's preliminary, but basically a brick building with metal highlights and not an all glass building. Last thing, ground floor, primarily retail. Here you can see the retail storefronts. Next slide. On 20, this is a view looking east on 24th Street. 8th Avenue is coming across at the foreground. Here you can see primarily a 10-story cornice line stepping up at the corner to 13, and then finally the top of the building at 14 stories. Again, the commercial, the retail store front at the base. One thing I would like to note, you can see it here, the ground floor has a nice high floor-to-floor height of 20 feet, making the lowest residential floor, high in the air, and then they're higher, typically higher than normal floor-to-floor heights throughout. Finally, on the left-hand side, you can see the building sets back from the east property line on the north side, and an entrance is created on the side street. Next. From a area calculation point of view, as Alvin said, here's the facts on the left. It's basically above and below grade, including the retail. It's 200 and almost 14,000 square feet. From a zoning floor area point of view, it's 165,000 square feet. I think the next two columns are important. Of the residential rentable area of 134,000 square feet, 22.5% or 30,148 square feet are the PFASH units. And then the units are on the right. The unit summary is on the right. It really parallels the mix, the PFASH units of 11 studios, 22 one-bedrooms, and 11 twos, totaling 44, really parallel the overall unit mix of the building. 180 total. Next. I will now walk you through the plans. We'll start at the ground floor. In all these plans, the orientation is 23rd Street is to the left, 8th Avenue is the top of page, and 24th Street is to the right. Pink here is retail. It's primarily a retail ground floor, and the tan color shows the residential lobby, the single residential shared lobby with access off of 24th Street. Next. The second floor has, working from bottom to top, but basically the amenities surround a common courtyard that's accessed from the amenities. Then there's a bike storage, which again is common to the building. And then the units start on the north, the top side of the page. In all these plans, the PFASH units are the darker green, and the market units are the lighter blue. And I'll describe the distribution on the next page, please, where we get to the more typical floor. So this is really the third and fourth floor. There's a few, this is more the typical configuration. There's a few things I would like to point out. Number one, it's an L-shaped building with a lot of good light and air, and the PFAS units, which are really in the green color, face all four orientations. Number two, as Alvin said, we could have concentrated all the PFAS units on several floors, but we instead opted to distribute them over from 2 to 9. So you're used to looking at HPD plans where there's distribution requirements. Here it's a little bit different, but just suffice it to say that we've done a good job in terms of distributing these units. The other thing about that is as I said before, that we're talking about a normal, higher than normal floor-to-floor height here. And so the typical floor ceiling heights here are over 9 feet. And so the affordable AIRS units, PFAS units, and the market rate share the same ceiling heights and orientations. And finally, on this plan, I would like to point out on the third floor, there's some terraces near where it says A, B, C, D, that there's a roof of the amenity space. Those are actually for the PFASH units. Next slide. As we go up the building, again, the darker colored are the PFASH, the lighter color are the market rates. And you can see this is the 5th floor plan. You can scroll to the next one. Then I believe this is 6th floor plan. Similar, it starts to drop off, but there's some very good light, air, and views on this side. Next slide, please. 7th and 8th floor, and then finally the 9th floor with one unit that has a very nice southeast view. That's a split 2-bedroom. So I'm just now going to go into the units themselves. Next slide. We just selected some typical ones. There's a lot of variety of units here. This is a typical studio. It's actually the same exact layout, whether it's market or the PFASH units, 463 square feet studio. You'll notice that all of the units have a washer dryer in them. This is a very good layout for a studio with a sort of entry area, single bath, strip kitchen, and living room, bedroom. Next slide, please. Is the sort of typical one. Again, it's the same layout, whether it's market in this line on the A line, whether it's market or PFASH. It's a 676 square foot, 1-bedroom, foyer, entrance, one bath, a galley type kitchen, washer dryer, and the 2 rooms facing the street. Next. And then the 2-bedroom, the split side-by-side 2-bedroom for the PFASH unit, 976 gross square feet. Again, a foyer, a galley type kitchen with an open bar type arrangement, washer dryer in the unit, and 1 bath and a very nice walk-in closet in the main bedroom, the second bed. Next slide. I just wanted to talk through unit finishes. We have not finalized the finishes yet, but this will be the market rate units and the affordable units will have the same finishes, and we will not distinguish them. They will be of a high grade, and you could also see the sort of high ceilings here. You'll also notice in this kitchen that it is, as Alvin pointed out, the accessibility features of the shelf, of the slightly lowered cabinetry, and of the microwave on the counter. Next. And then finally, the baths, generally a porcelain tile floor, ceramic tile walls on the wet walls, and as noted that grab bars, adjustable shower heads, a removable seat, and a removable vanity bodies for wheelchair accessibility. And with that, I will turn it over. That's the final slide, I think, is just a recap of the rendering, and I will turn it over to Lucia, who will talk a little bit about the construction schedule.
Thanks, Dan. So just really briefly, we're looking to start demolition this fall. That's going to take a couple months to do. And then construction will start probably spring of 2022. We'll start doing excavation, foundation, and work on through the vertical construction through 2023. We're anticipating that move-ins will happen in the spring of 24, spring to early summer of 2024. So that's sort of the broad timeline of which we're looking at. Al, do you have anything else to add?
No.
Okay.
Okay. I think if there are any questions from.
Yeah, well, there are going to be a lot of questions. Let's first start with some clarification, okay, Al? Can you just give me, Dan, the overall height of the building?
Yes, the height is approximately 165 feet high. 14 storms.
A quick question for you, Al, that all these PFAS units are permanently affordable, correct?
They will be affordable as long as, the answer is tricky, and I don't want to give an overly legalistic answer, but the true answer is they'll be permanently affordable as long as the building stands. Because
well, that's kind of how inclusionary works too.
Yes, right.
It's for the life of the building. So in
right.
plain English, they're permanently
English.
affordable, right? And there is some sort of regulatory agreement that governs.
That's correct.
Okay.
And there will be an administrative agent, just as we have with inclusionary. Settlement Housing Fund, a very reputable organization, will be doing the marketing and leasing of the apartments.
And the reason I'm asking you these questions is because we haven't dealt with this before. I wanted to understand how it aligns with elements of inclusion.
There are a lot of similarities between this and the inclusionary program.
The other portion is they will, of course, be available by the HPD Lottery and HPD Connect, right?
Absolutely.
Okay.
Absolutely. One thing that I wanted to point out was that I'm sure committee members want to see as many senior or eligible people in the community getting apartments here. So one thing which we are going to do is to notify you when we are going to be starting the marketing process. So you might, I don't know what kind of outreach you have to your community, but that's the important part, to make sure people know about it. It's advertised in papers, but I don't know who even looks at the newspapers. You know, it's people, we wouldn't want the lottery to come and go and nobody knew about it. We're also going to arrange with Settlement Housing Fund to have 1 or 2 educational sessions pre-marketing, so that those in your community board who want to apply understand the HPD process, how to apply. I don't know what, at that point, hopefully we'll be beyond COVID in a couple of years from now. And perhaps those sessions could be held at your community board.
Yeah, the community board has done this before very successfully to really increase outreach. And we have in some cases like tripled the outreach.
Exactly. So we want to work with you on that.
So another question, in this lottery, there will be the standard 50% community board preference?
Correct.
Okay. Then let's just talk a little bit about distribution first. And for those committee members who have not been, when we handle inclusionary applications, we have these same 4 or 5 questions that everyone's very familiar with.
I think you mean community district preference, not community board.
Yes, of course, community district preference. That's that. Thank you, JD. So the distribution, the one thing that struck me, and maybe can we put back on the screen for a moment, the layouts with the different colors, Nellie? Yeah, further back, go to the second floor. Great. So this looks very good because you made a point of saying that there are multiple floors and multiple exposures and everything was very good. But when you page through it, next page, Nellie, we end up with most facing into the court. Next page. Same thing again, facing into the court. Next page. Again to the court. Next page. And then again into the court. Next page. And there we go. So can we take it off the screen for a moment? The board certainly appreciates that you've been able to distribute them. There's no requirement at all. You're doing it. You're figuring it out. However, we do know that eventually another building could be built to the east. So I think we're going to ask you to consider a little bit of distribution that a little more liberal on making them where there's going to be light and air protected forever. I put that out for you to think about. That's all. We can discuss it further. One of the outdoor space. Can you just describe, Dan? Is that in common? What is it? Can you explain what it is?
So I referenced 2 outdoor spaces. One is the amenity outdoor spaces, and yes, that will be common to the building and accessible for the PFASH residents. And the second is.
Well, accessible to all the residents.
Correct. Not only, right. So the other thing is there was some private terraces, outdoor space associated with the PFASH units that's one of the benefits in the courtyard.
Right.
And I just want to say one thing about the courtyard facing units. There are 2 units that face north, and they'll have permanent, since it's our lot that they're looking over, those north facing units will all in perpetuity have, views, and some of them are really quite nice, Empire State Building and so forth.
Oh, sure.
It's not only that the other if the building gets built next door that they'll be blocked. It really will be protected because it's on the same lot.
And then Al or Dan, could we go to the question of amenities? So there seem to be 2 separate, can you go to that slide, Nellie? There's one that talks about this space and that space. I think I understand that.
So in general, there are 2 major types of amenity space. There's lounge, and then there's gym. I mean, and more than that.
There you go. Right. Got it.
It's still in play, right? But the amenity on the right, which says heirs accessory facility space, is really a lounge that will be available to all residents and have doors out to the terrace.
So maybe you want to relabel that it's accessible to all also. It felt like it was segregated, and I guess it's not, which is good.
It's not. That is not at all. That's not the intention.
Great. And then the other one is a gym.
Right.
All right. So normally we always ask if there's a gym is that a gym with a fee yet? Do you know where you are with that process?
I can answer that for you, Joe. We're still figuring out what that whether there will be a fee or not. We know we're sort of planning for something that's happening in 3 years, and so we're still working through that, to be very honest. But one thing that we've already made a decision on that is that if it is a feed portion, that we would offer any of the PFASH units a 50% discount to that rate, whatever that ends up being. If any, it's still a little bit too early for us to make that decision as we're finalizing that program.
Understood fully. And Mr. Shine's been to our committee many times enough to know you would ask that, and you've answered it before we asked it.
Cool.
So, thank you very much.
Sure.
And then go to the finishes toward the end, Nellie, that show the cabinets and everything. So we're very happy to hear that the departments will all be the same. That's a very important thing for our committee. And the next question we always ask, but I have to ask you, this is a luxury building that will have plastic laminate cabinets?
So let me just be perfectly clear. We did not want to, we haven't selected the finishes. We did not want to overpromise. I am sure it's going to be nicer than that. I would really want to say this is the minimum. It would be our full expectation is that all the units, PFASH and market rate, will have higher grade finishes than.
So then I just think in this process, we normally ask you, Lucia, and the developer to present a letter of commitment saying what you're doing. You can note what that is, because we are not going to take this as the example. I can't imagine, in a million years, I cannot imagine anybody doing this in an apartment for luxury rents. Right. So it's strange credulity at best.
Well, we'll find out how luxury the rents are in 3 years from now.
I will tell you that everyone I've been speaking to extensively is imputing quite a lot, because we're not going to be in this hole forever, guys. The world will eventually change and come back to somewhere where we were. So given that, I'd like to go to the committee members first. Oh, last question, Al, you said this is a 421A also?
Yes, it is.
Okay. So that's important for committee members to know. Nellie can take it down, that there is a tax exemption here, and that is another benefit, but it's from the state. It's not from the city, of course. All right, so let's go to committee members with hands raised first. Let's go to Dolores.
So, sorry, Joe, the laminate is actually luxury for me, but that's just me.
I'm talking what's built today is not.
And since our conversation morphed a little bit into a land use sort of presentation, just had a question in terms of the property that you're building to. Are you building as of right? That's the first question. I'll let you answer that, and then I'll have one other. Thank you.
It is as of right.
It's as of right.
Right. Are you building to the full FAR that you're allowed at this space?
Yes.
Okay. And the primary question I have, considering that it's as of right and you're building to the full amount, I think what I didn't understand from the beginning of the presentation is this program's ending. This will be the only one in Manhattan. What in terms of approvals, et cetera, do you need? Because it sounds like you already have a construction schedule, you're moving forward. So I think it's very important just to spell out what you may need from the community overall, if anything, to move forward.
But also but Al, important to say, explain what the ZQA gives the developer, because that's the part we missed in the broader discussion, right?
So, and this is pretty complicated, and I don't want to over lawyer it, but under zoning, and this does not apply to every zoning district. It applies to some zoning districts where if you build AIRS units, and we're using AIRS and PFASH interchangeably because basically the same thing, you get a zoning bonus,
right,
as specified in the zoning resolution. This site is lucky enough to be in a zone that provides for a zoning bonus if you build AIRS. So that's the incentive for the developer. They're going to have more square footage to build. It's not, the bonus is not as much as is under inclusionary. It's a 1-to-1 bonus, 1 foot bonus for 1 foot of senior. And so the bonus really applies to the senior units. You don't get anything over that. Now, in order to memorialize that, we are at HPD to get a regulatory agreement. You need a regulatory agreement to give to the Department of Buildings so you can get a C of O with the bonus. I would say that, by the way, this zoning resolution doesn't say it has to be a regulatory agreement from HPD. It's a regulatory agreement from any government agency. So quite frankly, my plan is to go to the state and going forward and see if I can work out a program with HDC, perhaps, or the HCR to move forward. But that probably would take a couple of years. It may or may never happen. But HPD we're going to get a regulatory agreement here. I'm going to get a few more for others in other boroughs, and that's going to be it. The program's over for now.
Well, so let's step back for a second, Dolores. If everybody remembers, MIH and ZQA were presented to our board. They were so not fully baked. They were full of errors, contradictions, issues, and they were ideas that were masquerading as full-blown worked out zoning. So that here we are today, 5 years later, and we're engaging with it. So that's good for us since we know a lot about it. And it's good for the developer because at least they're acting responsibly and trying to figure out a way to make this thing work.
Well, Joe, I still don't have the answer.
Yeah, I know. I'm about to get to. I know where you're going. So this is a C27A zone. That's an R9A equivalent. And if Al, you can just say FAR of X going to FAR of Y, people will understand that.
What? Well, Dan is the
architect. Or Dan, sorry.
You should ask.
You're on mute, Dan.
Unmute yourself.
How many months do we have to do this before we
No.
So it's 7.52 is the basic, and it goes to 8.5, but let me just verify that while we're
right. So normally in inclusionary, Dolores, it's 7.52 up or 6 up to 9 for an R8A, right? In this case, because it's not the same ratio as inclusionary, 7.52 up to approximately, Dan?
No, it's 8.5. I was correct.
8.5. And that's because the benefit is less. So everyone understands it's not inclusionary, it's something else. And then as Al said, is that it's not going to happen. But the truth is, it's still going to exist in the zoning, folks. So some other incarnation of this may return, and we really should note the HPD's desire or the decision not to proceed with this is bizarre at best. Also, Al, our community board has no problem taking issue with HPD. It happens all the time. And we will note that in general. We said this program could work kind of. Here we are today, it's working. And how does it work? Why should it just be stopped? Next person, Dolores, any other questions?
I still don't know what part the community is playing in order for this project to move forward.
Let me just, if I could answer that. We actually, unlike inclusionary says that you are required to notify the community board, and there's a 45-day waiting period from the time you notify them until you can sign a regulatory agreement. That actually does not exist for AIRS. There's no structure. HPD's said, let's do this like inclusionary. Please notify the community board, and that's what we're doing. We're not unhappy to be here. We're happy to present, but it's at the request of HPD. There's no actually regulatory reason why we're here.
Got it. Thank you.
And maybe Dolores, as part of our general opining, we might say, fix that, right?
Right.
Jessica Chape.
Thank you. I was just actually hoping, and maybe Joe, you were actually just alluding to this, but if you can speak to, I guess this is a two-part question. Why has the decision been made to end PFASH? And is there something in its design that HPD now finds problematic that we want to,
Can I ask, this is a broader policy thing that we have a thing in front of us. And I think those questions we should not direct to this developer, but let's direct them in a letter separate to HPD. That's the real issue.
Sure. I guess I just want to raise for our committee that if there's a problem in the design of this program, that knowing that a building that's going to comply with those characteristics of the program could be problematic for us. And
that's not the issue. Sorry to interrupt.
And
it's not conceptual. It may be from City Hall. We don't know what the political background is here. Nobody's talking about why they don't want this to go on. There's nothing wrong with the program. Everybody loved it, and now they don't love it.
Let me just note that in my quick research, Jessica, in the last couple of days, I've gotten 7 stories. So that tells me there's politics afoot, and we should probably, we should write a companion letter about the program, I think, because it's odd that this was pushed so hard by the mayor in 2016, you could not believe it. So
I think for our committee and maybe for Chelsea land use or like the land use committee.
The land use committee should probably opine on this. Yeah. Maybe what we do is we refer it to both land use committees for next month.
And then I guess.
Sorry, if you're planning to write a letter, I would suggest you send it to your council person as well, because he may not be aware of what's going on either.
And then I guess my second piece, and maybe it is less relevant, but just with the program ending, are there any concerns about your ability to or about concerns of continuing to comply or be if this program goes away, and who then is tracking or monitoring, anything we should be aware about the fact that the monitoring element might be different because.
No, it's going to have the same structure as inclusionary. It will be under the jurisdiction of HPD going forward, and there will always be an administering agent responsible for renting the apartments, just as an inclusionary. So that part's not going to change. All we have to do is sign a regulatory agreement, and then
Jennifer, in general with these, Jessica, sorry, in general with these programs, they come and they go all the time, but they end up with regulatory agreements monitored by HPD Asset Management. There's a whole institution that lives beyond the actual program acronym.
Great, thank you.
Next is JD, and then Josephine.
I'm trying to find something critical to say about this project. Having trouble. It's really great work. If it does come before the board with a letter, I'm sure questions will come up about sanitation of the garbage to the trash. I'll direct that to Dan. That's bound to be a question that will come up about your building.
So thank you, JD. So it basically, there's a separate, well, trash goes down the chute. There's a compactor in the basement, a subcellar, and then it comes up the elevator. There's a separate service entrance onto 8th Avenue where trash will be brought out to the street at the appropriate time.
The
That
issue
also will serve move-ins and move-outs, and so keeping the garbage off of the side street.
I think the issue, Dan, is where it gets stored.
Yeah.
Below grade until the scheduled time.
There's a trash room below grade in the compactor room.
Yeah.
A couple 100 square feet of just storage down there.
Right.
Okay.
Thanks, Dan. Good project. Really good.
Josephine.
Hi, Mr. Shine. You had said that the units will remain, the affordable units will remain affordable as long as the building exists. Does that include if it's sold? If the building,
Yes,
okay.
absolutely. The regulatory agreement is recorded, with the deeds, which means it runs with the ground, and anyone who buys the building assumes the same obligations.
Thank you.
Betty is next.
Hi, thank you for the presentation. I live in Penn South, which is across the street, and I have a couple of questions. Why don't I just say them all, and then you can, I don't know who wants to take it. I'm a little unclear in what is in the courtyard that looks like this space that's there. Many of us go to CVS. What's going to happen to CVS? Similar to what Joe's reaction about the apartments distribution, I was sort of knocked on the head when I saw the affordable units all scrunched together, and I don't see why the affordable units can't be more scattered among the market rate ones. How many elevators are there? And you probably are well aware, there's many senior citizens in Penn South, and there's a very vital community center there. And I don't know if there's some synergy between the affordable senior units in this new building versus the other one. And I'd love to see a little more of the outside of the building shown with the bricks and the metal, to get a better flavor of the color and what it looks like with the materials. That's it.
So maybe I'll start and then others can jump in. So on the courtyard, just so it's perfectly clear, it's located on the second floor. And as I mentioned before, it's a high ground floor, so it's 20 feet above grade. So it'll be green. So it's really think of it as a raised terrace that's accessed for the building. It's a raised terrace for the building residents and won't be visible from the street. A number of elevators. Right now we're planning for 3 elevators, which 2 passengers and 1 combination car, which will help with the trash issue, and which is really for that number of units. It's really on the upper end of elevatoring. I noted about the distribution, and I can't speak to the tenancy. Lucia, do you want to talk about the CVS or the Walgreens?
Yes, the CVS has a lease that's through the end of August of this year. To be honest, I have not heard from them as to their plans of a new location or where they're moving. So I'm not sure what's happening with that. They're not confirmed to take any new space with us, to be clear. So I wish I had a better answer for you, but I don't. I don't know exactly what's happening with the CVS, but my understanding is that they will be in operation through the summer. to address a couple of your other questions, the senior community center is certainly something worth looking into. I don't know about it, but it's good to know. And we can discuss anything with ownership as it relates to the center and possibly Alvin, any outreach that would need to happen there, as we talked about, as Alvin sort of annotated in the beginning. And then in terms of the outside colors, you want to know just as much as me, and I work on this every day. So I think as we torture Dan with decision making over the next couple months of design, there will be more information available, and we'll discuss with the ownership about what stuff can be shared.
It might be, Dan, though, helpful to give us at least a direction in which you're going. So this can be shared with the full board as part of a presentation, so those don't become the major bits of discussion.
Great. Yeah, and the real truth is we haven't made a decision or even narrowed down the huge world of colors. But first of all, it's going to be a brick building with metal highlights, let's say, and the metal highlights are there to give some interest and movement to the building. The bricks we are looking at are in the sort of gray tones, where the sort of, and the range we're looking at are ranging from limestone to, let's say, to medium dark gray. That's the range of samples that we're looking at. We're not looking at a red or orange building. We're looking at something a little bit more neutral. But and the metal colors, perhaps that's where we'll introduce some more earth tones to the project. I'm not being vague.
No, it's fine.
But
all we
that's
need is some direction, and we'll put that in writing, and that'll be helpful.
Fine. Okay.
Our last community member is James Wallace to ask questions, and then we go to the public.
Hi, Dan Kaplan. Thank you so much, everyone, for presenting. You have an amazing artwork behind you. And as many people from this committee know, I'm like the only person who will ask about this, but I'm hoping that you will consider the role of artwork in your design. Artwork that's left as an afterthought looks like an afterthought, and it can really, for very, very low cost, improve the environment for the community and for seniors. So I was just wondering if you could talk to that for a moment.
Early days in the design, I will say that we do have one lot line wall that is quite visible on 23rd Street. I will say that Ken Horn is on the Zoom with me. He was our client on the 10th Avenue project called the Griffin Court and 10th Avenue and 53rd?
53rd and 54th.
Thank you. And there were two murals that Ken commissioned there, are still standing today, and something we collectively believe in. But James, it's just early days in our design, and we agree with you. It's something that'd be great to have, but we just can't.
Yeah, James, if you want to look at that mural, we had a contest actually, and we opened it up to a wide range of artists from literally around the world. And we got, Dan, I think we got about 80 or 90 submissions.
Yeah, it was great.
And we brought in people from various museums to be on the committee. It was a really fun process. And the mural that we did is beautiful and still there. And it got a lot of publicity and the residents love it. So clearly it's something that we're going to consider. It's a process, and if we do it, it's going to be done very carefully.
Great, thank you.
So let's go to the public, and Nellie, bring over Elizabeth Haynes and Robert Paulson first.
Hi, this is Elizabeth. I am a resident in Chelsea. I live at 300 West 23rd Street. I have a couple of questions. I'll try to keep them really brief. But the primary question that I have is the R9A equivalent zoning for our neighborhood for this specific lot would suggest a FAR maximum of 7.52, which would be a building height maximum of 145 feet. This building is, according to the testimony provided, 165 feet tall.
Yes. So just stop you for a second.
And I
What you're
realize
just-
it's because of PFASH, but I'm trying to
Right. Yeah, that's one of the benefits you get is both the bulk, but also relief on height. So that was the guts of this zoning for quality and affordability. Go ahead, please.
So is it the case, because as I understand PFASH inside the AIRS program, it's a 1-for-1 bonus square footage. So could they come back to us and say, instead of 30,000 square feet for PFASH, I want to do 50,000 square feet for PFASH, and I get a 1-for-1 and take it up to 20 square?
No, there's a cap.
It's cap.
The cap of the height cap is 175 feet.
Okay.
So we're below the cap, and so that there's a maximum height.
But if we were to have a different sort of building on this corner, not one with PFASH, not one with AIRS, then the maximum height for that building would not be 175, it would be 145. Am I understanding the regulations correctly?
Yes, that is absolutely correct. So once the city changed in 2016, inserting the AIRS requirements under the zoning for quality and affordability, it gave any owner in a certain type of zone the right to go in the case from 145 to 175. Dan, is that correct? Dan? Yes.
175.
Right.
Okay.
You're correct.
Got it. Okay, so that answers my first question. Thank you so much. My second and final question is, there was commentary and discussion around whether or not the affordable units would have to be remaining affordable at the time of a transfer of ownership of the building. So I have two follow-up questions on that. The first is, what if the building is not transferred, but it is modified? Any sort of modification, for instance, a change in zoning that would allow it to add space or to expand, would those same units have to continue to be affordable? And then the second question is, at a time of transfer of ownership, while the units may have to continue to be affordable, would they have to be affordable at the same AMI levels and proportions? You have
So let me actually take that. Yeah. So this is how I'm going to explain it from a policy point of view as opposed to this building. When the city of New York has any sort of programs like this, there is a regulatory agreement that is executed with all the AMI levels and the details and the numbers of units. And those are recorded against the property, irrespective of transfer, change of ownership, change of zoning, anything. It does not change. It's recorded against the property. So just like in an inclusionary building, it does not go away because there's 17 different changes on ownership or the nature of how things are done.
Let me try to put into what I think I heard. Let's make sure I heard it correctly.
Sure.
If there was a transfer of ownership, they could not decide at the time of transfer to take the 10% of the units that are 40% AMI and turn them into 60% AMI because it's still technically affordable.
Correct. They cannot. It is these agreements are totally binding. I'll use a legal term upon all successors and assigns. They don't get to be reopened or redone. They stay. So then go to Robert Paulson. Questions?
Hi, yeah, I live at Chelsea Gardens at 255 West 23rd Street, and my apartment faces west. So I get to watch everything as the building goes up. There goes my views. Could someone go over a little more in detail exactly like when demolition is going to start and go over the construction schedule again, please?
Sure, I can do that. So demolition, again, as I said with the CVS tenant, that they're not leaving the building until the end of August. So nothing's gonna start happening until September at the very earliest. So through the fall, we'll be doing demolition, and then once the building is demolished, obviously start a foundation program. We're stepping back from the property line if we have to go any lower. So we're trying to keep it really contained to our site and as little impact as possible. And then that'll probably run for, I don't have a full construction schedule because we're working with a construction manager to establish that. But in broad strokes, we'll be then going vertical probably around the spring of 2022, start going up. I don't know exactly when we're going to be fully enclosed, but we can, we'll obviously keep the community board abreast of like all of the.
One of the things that we have often done when we build buildings, and on the Alchemy side, I think we've done 35 in New York, is if the community board would like, we can give them a forward look on a monthly basis as to what we intend to do on the site.
Sure.
In terms
We
of
do that in
demolition, foundation, superstructure, bricks. Sometimes it's helpful. A lot of the community boards like that, and we could certainly work something out with you in terms of submitting the forward look as to what's going to happen on the site as we build.
Sure.
We always work with look-aheads, and our district manager will incorporate that in a letter if we really find it useful, because it sets expectations as to what's happening. And really, the more people know, the better when they're adjacent.
Yeah.
Also add on that communication to Penn South would be really desirable. The same kind of monthly updates, to go to the manager, and they'll distribute it. We have a newsletter.
I think we should let Jesse coordinate all that, because he puts all the participants together for those kind of.
Yeah, if someone could supply us with a list
of
those folks who want to be, and those agencies and those community groups that want to be notified, sometimes there are 20 of them, and we adhere to everyone who wants to be notified. We will clearly do that here as well.
So let's go to the next member of the public, Peter Borochow.
Thank you, sir. I also live in Chelsea. I live at 300 West 23rd Street. And other than the community people and Betty McIntosh, I haven't heard anybody talking about how it's really going to affect the community and the buildings directly around it. It was nice to see the finishings in the kitchen and all the rest of it. But number one, it really concerns me that of the PFASH, only 20% of the building are PFASH apartments. Is that correct? 44?
It's more than that. It's closer to 25%. Just
okay. But to use 25% to build a 14-story brick and glass tower on that corner, my first question is, will there be exterior lighting to add additional light pollution? Have you thought about all the additional people coming out of that tiny little subway hole on 23rd and 8th Avenue? The building does not seem like it belongs on that corner in Chelsea. It's humongous. 14 stories there? I just don't understand why it has to be so big.
Just to note, if it were built today,
yes,
with a standard floor-to-floor heights, it would be 14 stories. It just would be 145 feet, which is
okay. I'm more concerned about the height. Fine, then let's go with the 145 feet than the feet.
So we're talking now about it's 20 feet more. So this is really
20 feet when it comes to views and light and air, which you keep talking about, is quite a bit.
Right, but I want to say again, it's interesting that I'm getting a lot of stuff in the chat about this is a land use matter. The problem is we should consider the program as a land use matter, but this land use matter, unfortunately, was decided and debated in 2016 by the board and the city government, and is part of our zoning resolution. So that's one of the issues we have here. It's like inclusionary housing. Some of us felt in our community that we shouldn't be using inclusionary units that were subsidized by other programs, but that got passed. So that's what we have to deal with every day. So we can certainly speak against the program, which is fine, but this is the program. So that's one of our issues.
What about will there be exterior lighting?
Yes. Question?
Will there be exterior lighting?
No, I'm sorry. I was asking for someone to answer. Dan, maybe?
We are currently planning on exterior sconce type lighting at the lower levels, and exploring other types of lighting in the building. Nothing has been really final.
But this building will not be lit.
Well, where are the sconces that you talk about? At what
at the storefront.
Storefront. So storefront levels, nothing above, nothing at 3 stories or 4 stories.
We honestly, we haven't gotten there yet.
The real question is, will there be light pollution from the building to the surrounding residences? Isn't that your question, Peter?
Yes, that is exactly my question.
Okay.
So we will, thank you for the clarification. We will adhere to all the regulations regarding that, including, dark sky and so forth. And, again, if we do include exterior lighting, it will be shielded and so forth.
So we will note that in our position also.
Okay.
Thank you, Peter. Brian Matlin.
Yeah, hi, thank you. I have 3 items. I'll try to blurt them out as fast as I can and let you respond as you will. One is with respect to the demolition and construction. As you well know, you're sitting in front of a bus stop, you're sitting on top of a subway station. And so I'm wondering what accommodations, if any, you can or will make to minimize your interference with public use of public transportation while this work is going on. With respect to the art item that came up earlier, and I'm failing to dredge this up out of my brain, but there has been for some years a mural of some historic significance. I can't remember the subject matter or the artist, but it is of some historic significance and local interest that's been kicking around in storage looking for a new home. And if you have any interest in that whatsoever, I can try and track down the information and convey it through the community board. And then the last one really keys off the last questioner's point. I mean, you know, other than the southwest corner, which is a pretty massive building, everything around this is low level. You know, on the other side of 8th Avenue, you have a 3-story building at the south end of the block going to 1-story at the north. You got a 1-story building across 24th Street going up 24th Street towards 7th Avenue. Until you hit the high school, I don't think anything goes much above 6 stories. I understand this is all completely within, you know, regs and everything like that, but have you done any studies? And if so, what are the results of your studies of impact on light and air to the surrounding blocks? And thank you.
I can address the first question about just the coordination. We have to coordinate with the MTA for all of these entrances and the logistics of how we're putting up any protection, sidewalk sheds, anything that goes on with the MTA. We have not gone to talk to them yet. I anticipate that happening next month. And so we have to follow what they tell us to do. And that's what we will be doing. But there's no intention of moving or intention, I say now, of moving or closing anything. Definitely not permanently. If they tell us to do something temporarily, we'll have to listen to that authority. But that's really what we have to do to coordinate with them.
I think I just want to make it clear for the public. It's fairly common that a bus stop gets moved during demolition or construction temporarily. And we've seen that on many construction locations, so we should probably expect that. As for the train, this developer will have to do whatever the MTA says. That's our issue happening on the 7th Avenue and 22nd Street development, and that has been held up because of the MTA giving approval. So if you think there's any flexibility from the MTA, there will be none.
If you know there might be, we're open to it, but no, we're gonna deal with that.
Whatever they tell you, you have to do, basically.
Yep, exactly.
Next question. Brian, you got your 3 in, correct?
Yeah, but only one got answered.
I'm sorry. Give me more. Go back to them. I want to copy directly.
Okay. Well, the second one wasn't a question. It was just a comment that if the developers have any interest, there is a large mural of some historical consequence and significance to the neighborhood of Chelsea, sitting in storage somewhere looking for a home, and I could dig out that information.
I can address that. We'll certainly like to see it.
Okay, I'll see what I can find out. And then the last question was about, have you done any study of light and air impact on the surrounding blocks and buildings, all of which are obviously, with the exception of the southwest corner, much lower profile?
The short answer is, without sugarcoating, is no, we haven't, because it's a as of right development. And, you know, we assume that was done in the
light and air is studied when there's a zoning change. The zoning change happened in 2016, and that happened at that point in time.
Yep.
Okay.
Our next person is David Perlman. David, you're on mute.
Okay, sorry. Thank you.
There you
go.
go.
I thought it was a good conversation. I have a few questions on the affordable and then just on the building itself. The first question on the affordable is, have you guys done a comparison between, because the point was mostly the affordable units on the interior, looking at a courtyard, a wall, not that attractive of a unit. What's the market rent for those units compared to the affordable rent? What's the difference? I don't know if you've done that study. And then I have a few more questions. And then in terms of this building being ADA compliant and with the subways down below not being ADA compliant, are you going to work with the MTA to try to make them ADA compliant, maybe get some elevators installed? And then in terms of being green, I know the city has a big initiative to make the buildings green and especially be green compliant in like 10 years for what like hopefully zero carbon emissions. What are you doing for that? I know I'm very familiar with like LEED, but I wanted to know if you're doing anything that's different, like adding planters above, doing some sunshades, things like that. In terms of the comments from the people at 300 West and the point that one corner is much taller than the other two, have you considered, I know that you have the right to build up to 165 feet or 145, depending on if you have the affordable, but have you considered doing step backs on the corner of 23rd? I know you want to make a statement piece there, but it seems like there could be a compromise to not disrupt so much light and air, especially with COVID and people staying at home more. I understand the concern of residents that will have some disruption based because you are making the corner on 23rd and 8th the highest point directly on that corner, not having any step backs. Didn't know if you can like have a couple of step backs there and kind of come to a nice solution with your neighbors. And then on the affordable stuff too, just one question, out of curiosity, if somebody is 62 and they have kids, the person that, you know, eventually leaves that place, they're the older ones, and the kids take over, is it still, could the kids stay there for as long as they want? And then
these are rent stabilized units.
So that once it's locked in, the person can stay there for generations. Okay. And then what I know you guys have the right to build here, but it just seems like you haven't really spoken to the community about what you're doing here and getting their input. So it seems like you're just putting something out there, hoping it sticks, and just kind of in a way bulldozing your way through this, which is you have the right to do that. But again, you're dealing with a community that wants to be, you know, feel like whatever is being designed is kind of included in like the overall community. And then just on the sponsorship, I know Alvin mentioned they've owned this property for 30 years. I don't think that's true. I think they bought it a couple of years ago. And they, I also just want to know what their experience is building a building of this size and their experience, if they have experience building a tower in Manhattan, and if there's going to be any construction defects, things like that, that the community will have to kind of deal with, constant, you know, construction people on site fixing things. And then also their experience managing a building that has both mixed and affordable. And then also as the streetscape, I know people mentioned light pollution on the streetscape, but are you guys putting any planters? Are you redoing the sidewalks to clean it up? Is there anything that's going to go on to kind of like freshen up this corner besides making a point on 23rd and 8th be 13 stories and then the 14-story setback?
So you have a lot of questions, and I'm going to try to see if I can summarize them.
And they're all excellent questions.
No, it's just that
I will take a couple of them so I could kind of knock them off.
Yes, Ken, in 1 second. And as we go through it, David, if we miss them, we'll come back. So just
okay, I appreciate that.
Okay, first off, in terms of market rents, you know, COVID has slaughtered the rental market, as we all know. And all we could do is, as I think someone commented, Joe may have commented or someone else, we're hoping that we finish the building, the rental market comes back, and that the investment that we're doing here really pays off. But to say what we think we're going to get in rents 3 years from now, we don't know. We really don't know. We've done market studies.
The interior ones are going to be less over time, though. Sorry.
Obviously, it's going. Obviously, the fair market rents are going to be more than the affordable rents. I mean, the luxury market has taken approximately a 30% hit from COVID. We're hoping that does not remain and that we get restored. In terms of our building experience, my company has been, I'm the president of the company. We've been in existence 30 years. We have done 32 buildings to date. This is a building that's almost the exact size of what we do. We just finished the upper 30 floors of the Woolworth building of the developer, equivalent size. We're currently building a building now at 378 West End Avenue, which is, Lucia, what, about 170,000 feet, 180,000 feet. We just finished a building on 6th Avenue and 30th Street, the NOMA, which Dan was the architect on. We also finished a building recently at 250 West 81st Street, equivalent size that Robert Stern designed, very well received within the community. So in terms of our experience as developers, we've been doing this for 30 years. We have an impeccable track record, never defaulted on a building, never had issues with the community, never had issues in buildings that we built. We are very, very careful in terms of how we build. And, you know, you could check out our track record. You know, this is something we've been doing for 30 years.
So, and I just want to know for the public too, that the issue of when they come, this is not a zoning change that would come much earlier and there'll be a lot more community discussion. This is basically a compliance for certain levels of affordability that are baked into the zoning. Dan Kaplan on answer some of his questions, and then we have to move on. We're ready at almost 9 o'clock.
So green, we are, and what you were asking about is local law 97, which is basically a carbon tax, if you will. We are very cognizant of that, and the owner who is planning on holding this building for a long time was eager to avoid that carbon taxation. So we're employing very energy efficient VRF equipment, and then we are also pursuing what's called a zone green program, which will basically allow for thicker insulation at the perimeter of the project. And as I mentioned before, this is primarily a masonry building and not an all glass building, so it'll be heavily insulated. In terms of improvements, yes, we were going to be redoing the sidewalks and basically cleaning them up. As far as the MTA elevator, that really is outside of the scope of this project, and basically this project could not happen financially and support the building of an elevator for the MTA, and also include all the affordable housing. The setback, just so you know, the building is 14 stories tall. The setback on the corner of 14th and on 23rd and 8th is 13 stories tall, but the part further to the east, it steps down, and most of the frontage on 23rd Street is 10 stories tall. So we have actually stepped the building down or away, if you will. And there is an open lot between that building and this building. So I think we have stepped the building back. I think those were the majority.
I think we got them almost all, David, right?
Yeah, basically all. I mean, I was just, and then it's just the sponsor's experience managing something with a mix of market and affordable. And I also had the art question too, but which was answered before. But yeah, the affordable and the market.
In terms of management, we really haven't decided whether or not this will be self-managed or we'll bring it out to an independent managing agent. We just really haven't discussed it internally as to how we would do that, frankly.
But I'm assuming you have other buildings that have a mixed incomes.
Let
me jump in on
Go ahead.
So affordable housing has two parts to it. One is management, building management, which is the same as managing a luxury or a market rate unit. So you need the same services and the same responsiveness which you get from a managing agent. The other part is lease management, that is dealing with the affordable tenants, lease renewal, renting up vacant units. That's a different function, which will be done by not-for-profit agency. So, and they have the experience in dealing with affordable units. So it's really a two-part test here, and there's really no issue because the part that deals with affordable housing will be dealt with by a not-for-profit under contract.
And we should note that, like an inclusionary, there's only initial income certification. There is no annual income certification.
That's
you
correct.
Come in under your income. If it changes up or down, does not affect your continued tenancy.
That's absolutely correct.
And just one note for Ken, I guess, and that is you have a street tree issue because of the MTA. So we may ask you to sort of agree to work with MTA to do revocable consent for planters so we get some green on the street and it is not so empty.
Yeah, well, we actually were at the building, Dan, when Lucia went yesterday or the day before, and that's something that we actually just began to discuss that.
Great. Yeah. Let's go to Brenda, followed by Pam Wolf. Brenda, you're on mute. Brenda, I can't see your full name, unfortunately. All I can see is Brenda Slocco.
Hi, I work with Alvin. I'm just here as an observer.
Oh, got it. Okay. Go to Pam Wolf.
Hi. So I'm Pamela Wolf. I'm a public member at CB4. I'm on the Chelsea Land Use Committee. And I got a heads up about this very shortly ago. I'm also involved in the Chelsea. I live in Chelsea on 21st Street, and I'm involved with a number of local civic groups. One of them is the Council of Chelsea Block Associations. We have a system of contact with all of the 15 or 16 block associations in Chelsea. That puts us in a position of being able to distribute bulletins that you would be putting out in the process while you're in the stage of building. It's very helpful to do that. I would have to say PS11 does that for us, and we get weekly reports which are distributed throughout the neighborhood, and it is indeed very helpful. Keeping the lid on things when people know what's about to happen, even if it's going to be horrible and noisy, they're better prepared than if it just happens. The buildings to the east of you, going along 23rd Street, are old and small. They will not survive for much longer. I have two things to say about that. One is that there will need to be underpinning, structural, I'm sure, for those buildings. And that's something that we're concerned about in Chelsea because we've lost a lot of, there have been some townhouses that took severe damage for not having been properly underpinned. The other point about that is that when they go, a nice tall building will be built there. And in looking at the floor plates on each of the levels where you've located the affordable housing, the vast majority of those units are facing east. A few of them are facing north only and have only northern exposure, but most of them face east on each of those floors. I find that a little concerning because that means that once a new building is built there, they're going to be looking into basically a shaft way or a narrow courtyard. And that, I don't think that's appropriate. I think those units should get distributed more evenly throughout the building and not be clustered. Someone else made that point as well. I think clustering them together is not what we want to see, certainly not in Chelsea.
But can I just say something, Pamela? Okay, do you mind?
Sure, jump on in.
I just wanted to, one thing I just wanted to clarify is that any building that's built on 23rd Street will have a required rear yard. And those units that we've planned that face east will look into the rear yard of the block. So we have an end condition of the block, and then those east ones will look into the rear yard. They will have to have a setback on the rear 30 feet of their lot. So I hear what you're saying, and I'm not pushing.
But they will still face interior and not have as much light in there. So, right.
And then the other point to be made is, and Lucia could probably address this as well, is any building that we build, we always work with the neighbors. We understand we're going to do property condition reports and neighbor agreements, which we've been working on. So clearly that's something that, a skilled developer knows how to do. And that's something we've been working on for what, Lucia, now about 4 or 5 months already.
So we're just to address your concern about underpinning, not to get into the weeds, and this is obviously still subject to approvals, but the plan is to leave existing foundation walls so that we are not disturbing anything of the neighbors. We're trying to have as little impact as possible.
Existing foundation walls on your side of the property.
On our side, which means that we then additionally step back from that property line when we're actually building. So we're not going straight to the property line or really leaving any room to do any sort of formwork there. So I think that that is a good plan. It's the least impactful to the neighbor, and should not require underpinning. That is the goal. Of course, you never know, but we are considering that, and that is something that is definitely on our radar, that we're working towards with our engineers as well.
I want to keep us moving tonight. Pam, do you have other questions?
I know, yes, I do. Having to do with trees, I believe there is space on 23rd Street for actual tree plantings to be done along that elevation. I know that the 8th Avenue side is not available for that. Also, 24th Street has the subway entrance there as well. It's problematic. Someone brought up the question about the mural that belongs to Chelsea that we'd like to keep in Chelsea. I can give you much more information on that. There is a group called Save Chelsea, which is presently in possession of that mural. It's a rescue job. It was removed from the bank on 14th Street and 6th Avenue that was taken down for the new building that's there now. It got salvaged. It has been stored for us, for our group, by Google in the building, in the Google building. And it's 110 feet long in 2 major sections. It is a beautiful work of art. It's called the Binford mural. The artist's name was Binford. We have been looking for a home for it for quite some time. It is very subtle in its design, and it depicts street scenes from 14th Street and 6th Avenue at the turn of the century and a little thereafter. So I would love to ask Jesse to put these people in contact with me, and I will plug you in with Save Chelsea, and we will see if we can arrange a viewing. But in the meantime, we have lots of photographs of the mural.
And you can always count on our board to have obscure information and know exactly where all the bodies are buried. That is one of our jobs.
But most of them are buried in Chelsea.
Thank you very much, Pam. Going to Chris, then followed by Martha Seymour. Chris LeBron.
Good evening, everyone. My name is Christopher LeBron. I'm a member of Community Board 4. I wanted to speak on Betty McIntosh's point, which has been brought up 3 times. I'm just going to preface this with, I am of Puerto Rican heritage. I grew up in a family of teachers and nurses and civil servants. And the distribution of affordable housing, in my opinion, is just an interior version of poor door entrance. When my friends' families in the past have enjoyed a lottery and they've been slotted in an affordable housing apartment, these are distinct memories I have. This is where the poor people live, and that's where the rich people live. It's very clear where the for-market rich buyers or renters you're looking for are going to experience homes. Dan and Kenneth, respectfully, I'm not expecting or would like a response to this. This is merely a statement as a minority, as someone who's grown up working class. Please distribute these accordingly, because the experience of living in this, knowing that you're less than market value, is detrimental to a child's upbringing. So this is not a short-term thing. It's not cute at all. And your response prior was a little insulting. So please don't just consider it, do it. You're really going to end up changing the lives of so many people by doing so.
Thank you very much, Chris. Going to Martha Seymour.
Yes, can you hear me?
We certainly can.
Can you hear me?
Yes.
Good. I'm an old lady that lives around the corner at 23rd and 7th in rent control, so I won't need that. But I remember when this neighborhood was mostly Latin, sir. But what I want to say is, really, have you thought about how Jean d'Arc residents might be going down? They're closing their place. I want to be able to constructively get around with my walker in this neighborhood while all this is happening. Thank you very much.
Thank you, Martha. Jennifer Malicote next.
Hi, thanks. I've been waiting very patiently and I don't even know where my train of thought is going to go right now, but I live on 21st
Try to keep it
Street.
focused because you're the last car on the train.
All right, 21st Street and 8th Avenue, 300 West 21st Street. I live there. I've lived there for 27 years. I have a Ritz stabilized apartment. It's the only reason I can be in New York. I am not pleased with the fact that you are wrapping in a cute little package, affordable housing for seniors moving east, more into Chelsea than everything that's happening on the West Side Highway right now. And it's just gonna continue. Like, that corner has been decimated for years. The Gap corner, Boston Market, CVS, like, it's just like, it's been dilapidated. And now you're gonna put up this pretty little building, which, you know, you wrap into something that's so-called affordable housing plus luxury housing. And you're just changing the landscape of the neighborhood. I also was here. I moved to Chelsea in 1993 when the Latin community was here. And, you know, people are playing checkers on the street and watching baseball games on the street. And there was really a sense of community. Now it is just so fragmented and not a fun place to live. My corner has so much drugs on it and so much illicit activity. You don't even want to know about it. And now you're just going to build this, you know, pretty building on 23rd Street and 8th Avenue. And yeah, just not down with it. Like, why don't you fix the neighborhood that exists now rather than trying to build it up into something that's luxury, and then all those people are going to get preyed upon from the bad dealings that are happening in the neighborhood.
Thank you, Jennifer. Any other members of the public, Nellie, do you see?
No, no one else.
Okay, so given that, let me just do a recap of everything we've heard tonight, right? That this is a AIRS or PFASH project. It's located in a C2-7A zone equivalent to R9A. It's producing permanently affordable senior citizen household units, 44 of those, studios, 1s, and 2-bedroom apartments. It is going from, the senior units get a 1-for-1 development bonus, going from 7.52 FAR up to 8.5 FAR. The units will be at 40%, 60%, and 80% of AMI, and of course our letter will embody how that gets distributed. It's also receiving 421A real estate tax exemptions. There will be, in the building itself, there will be outdoor space that is in the second floor and common, and then some private terraces for some of the senior units. The building height increases from 145 to 165 as a consequence of the density and the bulk increasing. The apartment finishes will be the same throughout all the apartments. They will all be permanently affordable. All the senior citizen household apartments will be permanently accessible. If there is a gym as part of the amenities, it will be a reduced fee, roughly 50%. We talked an issue about how to manage trash. We will touch briefly on the question of the majority brick building with some metal trim. We'll definitely ask for a 2-week construction look ahead going forward as this project actually gets into demolition and construction. We've made a note that it'll be dark sky compliant and there will not be lighting on the building, but at the first floor only. We talked about street trees, a lot to comply with zoning for street trees. And on the side where there's the MTA tunnel with the 8th Avenue line, we're talking about revocable planters and revocable consent, meaning to get green on the street. The things that are not settled yet, or that they're going to get a little more detail on, we doubt there's going to be plastic laminate cabinets and vanities, so they're going to make some representation as to what these things are in general. The biggest issue coming out of our meeting tonight, oh, I'm sorry, one more thing, that when it comes time for actual rent up, it'll be subject to HPD Connect, it'll be a lottery, they will do some community education, do some educational sessions on how to apply. We know the lottery will be 50% community preference. We'll also have them reach out specifically to Penn South and CCBA during that period of time, and the construction look-aheads also to Penn South and CCBA. I think the thing that has emerged tonight is from the public and from the committee members is that we're requesting that there be a more equitable distribution of apartments and not to cluster them all at one location facing the courtyard. And yes, we say to the developers, we've seen this before, while you have no requirements whatsoever to do this, and we appreciate what you've done so far, we ask you to do better. And we never expect you to say, yes, I can do this right now, but we expect you to go back, look at this carefully, and come to some sort of compromise. We then would, after we discuss tonight, ask for you to represent in a letter to the community board, here are the things we've agreed to. We take that letter, we attach it to your commitment letter, we attach it to the community board position. We've done this many, many times. And I want to say that I think this has been a solid discussion. And you've heard loud and clear, the issues are, yes, public art. I'm sorry, I forgot about the mural. Thank you, James. Thank you for the art sign. This developer has come to the board before, has been represented. This is the land use council and the architects come to the board before. They've heard these issues. And we ask you just to respond that you will go back in good faith, consider some of these matters that are still not quite settled, and then respond to the board so we can come to conclusion and give you support on this project. I asked Ken to speak to that.
Well, it's clearly something we will discuss internally. We will clearly discuss this internally.
Right.
Obviously,
And
we
again,
can't give a commitment one way or another, but we will discuss it internally.
And again, you should note that our board is nothing about, we're not the black and white, everything's got to be our way or the highway. It's compromise. So we ask you to go back, look at your plans, see what you can do to meet this board, and it's very reasonable, and this public, thoughtful, clear discussion somewhere in between. Given that everyone has heard all the items that I've listed out, have I missed any committee members? Dolores?
Despite the fact that the zoning is settled and it as of right, we've heard very loud and clear a concern about the characteristic of the community around it and that this building feels outsized for the community. Despite that we know that this is allowable, I think it is prudent for us to note, even though it's a policy issue, that we are hearing from the community a concern for the height of the building.
I want to note that we should note it because of the increment, because of the bonus, but not because of the zoning. The zoning is consistent with the Chelsea plan that was adopted at our community's request. So we have to honor that also.
Understood.
Any other questions?
Joe, in the list, did you mention light pollution? I missed it if you did, I'm sorry.
Yeah, I did.
Okay.
I called it dark sky, which is the technical term for not doing that.
Let me write that down. Thank you.
So given all those points, is there a motion to approve with conditions pending further resolution?
So moved.
So moved, second by Dolores. All those in favor, please raise your hand so it can be seen. Anyone on the phone? Okay. I believe this is unanimous. And I want to thank the development team, Al, Dan, the developers, Ken. We really, as you know, Community Board 4 does get into details. And thank you for engaging with us on this, and we really appreciate it. Thank you.
Our pleasure.
Thank you for your time.
Good night.
Thank you, everybody.
Thank you.
See you all.
Great.
Good night.
Thank you.
So we
Thanks,
have
everyone. Have a good night.
Joe, I was
Yeah.
ready to hang up, but yes.
We have some
new
quick
business.
updates.
Can I go first?
Yes, Maria.
So there was a meeting with DHS, the monthly meeting yesterday. And basically the most interesting update to me was that beyond the testing that's happening on site at the emergency temporary shelter sites is that they're also doing vaccinations now on site. And it sounds like many of the sites, they had it sounded like their first distribution March 9th. And slowly what they're seeing, a couple of sites mentioned, slowly what they're saying is that there's more clients or residents getting vaccinated as well as staff. It's a slow progress, slow process. But I wanted to share that.
Next quick announcement is, and the date is not quite set, I say this tentatively, Clinton Housing, Hudson Guild, and Hartley House have been working on getting a vaccination site at Hartley House on West 46th Street between 9th and 10th Avenues. and we have a tentative date of Good Friday, April 2nd, but don't hold your breath there because things keep changing with vaccine supply. And that will be a large vaccination of 380 shots. So it's getting much larger, and and the categories will be anybody who is eligible under the current rules. So that's an amazing broadened thing, and we will let everybody know, and the board will put out a major e-blast on this.
Is that the one shot? Is that the one shot vaccination, Joe?
Are you ready, Leslie? Today it is, but tomorrow it could be Moderna. I mean, the problem with the supply is we get informed like we get informed Johnson & Johnson, and then 2 days later it's Moderna. Like, it's really not, I mean, the federal government's trying, but boy, we are behind the 8 ball on this thing, guys.
So also, will it be whoever's eligible on the day that you have it? So for example, if right now it is 60 and then on March 31st, they say as of the 1st, it's going to age 50. I mean,
yes, it will be
able to adjust that way.
Well, 2 things will happen. One is there will be an e-blast out to register in advance because Ryan Chelsea is the partner here.
Okay.
So the 3 organizations will help collect people, like collect the names, get waiting lists, get it to Ryan Chelsea. And then what happened recently in Hudson Guild on the Elliott Center in 2 sessions, at 4 o'clock, if there were still unused shots, you wait in line and you go right in because no one's going to allow a single shot to be lost if the categorical eligibility is not being filled. That's crazy. So
that's also occurring at the Ryan Center.
At the Ryan, at Ryan Center too. So I think what's happening, go back to Dr. Zhang, like the community is trying to figure out everybody together, how to make this happen. What's the best location where people feel more comfortable? And by that, we're starting to get an uptick in the number of people getting vaccinated. Last item, update, Chelsea NYCHA. So for everyone should know that the Chelsea NYCHA final report came out like 3.5 weeks ago. You don't know that maybe because there was no publicity. It was not put around. So the board made a commitment in this process that once that report came out, we would have a public meeting to get public reaction on Chelsea NYCHA. The tenants of Chelsea NYCHA have been meeting with NYCHA and with Citizens Housing and Planning Council, actually beginning to work on how to develop the RFP. Hector has reported this before. Mike Noble on our committee has mentioned this. This is all proceeding ahead. We want to make sure that the broader public knows what's happening and we need to get input from them because remember, this will not go to a ULURP. That was the tenant's request and not go to a further public review. This could be coming out to RFP. Hector, when is the rough idea when the RFP may come out?
There's been no set date. We're still in meetings.
No, I'm saying approximately.
We were talking about approximately. They said possibly the end of next month.
Oh my God.
We set that, but that's not a guarantee.
Right. We're talking. It could issue as early as April or May. So we need to have a meeting. Unfortunately, sooner than later. I thought this was taking more time. We found out it isn't. So our date is March 29th. It will be a special meeting of the Housing Committee. And there'll be a large public meeting, presentations by the NYCHA tenants, by the various members of the working group, and we'll invite NYCHA, but it'll be mostly about, and Jesse will send out the final report in a huge e-blast to many people. We really want to get people to this. We're really taking questions and comments about the report. That's the focus. The report has been issued. It is the guide for what's going to happen in RFP. And we want to make sure that it will be a Zoom meeting, James. Trust me, that's all we got going on here.
Joe, how do people get access to the report if they wanted to see it?
It is going to be put on the board's website. And also will be sent out to all the board members. And Nellie, how many are on our mailing list now?
Oh, wow. I want to say maybe 4,000 or more.
Yeah. So it's really going to go out very, very wide, this thing, because we were very disappointed that like after it was put out, NYCHA didn't have many events about it at all. So
Are you saying it would be sent out physically?
No, Betty, physical doesn't exist anymore.
Oh, you mean the link?
The link.
Okay, it just was unclear.
You may take it and print out the 110 pages yourself, but it's going to be a link.
Well, I got a copy, so.
Is there a map in it?
Oh my God.
Yes, yes.
There's so many maps in it.
Betty's good with it.
So again, it will be an actual special housing committee. We will hear everything. And then the goal is that we approve, endorse, say there's issues, comments, not only our comments, but comments from the public. So that creates a record of what's happening here.
So Joe, this is not just an information session. This is an actual meeting where we will be voting on an action.
Yes, correct. Right.
6:30 is the time on Monday, the 29th.
Is that correct? Yes, Maria.
Yes.
So, and I apologize for the late notice. This was just, the date was just settled today because we tried to figure out how to program it in to the schedule.
If you need to plan for it according to the calendar, a calendar date, it's from 6:30 to 8 p.m.
Yeah. So, and I'm going to
Hold
see.
on. This is a regularly. This is an irregular housing committee meeting.
It's a special meeting.
Special committee meeting.
Yes. But it's a public meeting very specifically, and that's why we're making sure it gets noticed in advance. I'm assuming that we can get sort of a motion to adjourn. Anyone?
Adjourn.
I want to thank the public for being here, and I really appreciate all the committee members. Thank you so much. Good night, everybody.
Thank you.
Good night.